a lot of people in our population are facing, especially in the last 1 year or so due to COVID-19. As it is, if you see, we have lot of percentage of people suffering from back-related issues in our population. Just in a single country of USA, you can see that more than 31 million Americans at any given time are suffering from back pain. This results into a lot of loss of man hours, employee time, productivity, and just the expenses to treat this back pain and the loss because of the lost man hours can be astounding, almost $50 billion a year. Similarly, in a country like India, also we have this very common issue. Now, the common causes of back pain or neck pain can be direct or indirect. The direct causes could be wear and tear due to age, osteoporosis, that is calcium deficiency, or because of fall, because of infection or tumors, etc. But the indirect causes, which affect almost 75 to 80% of the population, they comprise of stress, bad posture, bad lifestyle in general, and inappropriate use of their body while lifting or bending. There are other factors which can be responsible for ongoing or what we call as chronic low back pain. What does it mean? It may not be just an acute pain, but pain going on for a long time or off and on pain, which usually results from certain factors like bad habits, smoking or alcohol, or a lot of emotional stress, socioeconomic status, etc. There could be other issues in terms of professional and personal life, which can also result in increasing back pain or ongoing chronic back pain. So in general, if you see, neck pain or back pain is a lifestyle disorder. Just like diabetes or hypertension, it results from bad lifestyle and can be avoided with a good lifestyle. So what is a lifestyle? It is the way you conduct your life. All of us are born with a certain kind of genetic predisposition to certain disorders or health. But it is your lifestyle, how you conduct your life every day, which decides whether you'll end up with issues or diseases like back pain. So in general, if you consider our lifestyle, it comprises of your professional expertise, your health, your family time, and your socialization with friends. And the balance between all these factors will decide whether you'll end up with a lifestyle disorder or not. So the bad lifestyle can directly result into low back pain if you have poor posture, poor eating habits, poor habits like smoking alcohol, or if you're spending your life sitting in front of the TV or computer all the time. So the way you professionally use your body also decides whether you have these issues. So now we come to exactly why in last 1 year these problems are increasing. The most important factor is a lot of people are working from home. When we are 6 months into the pandemic, that was last year, a certain study conducted by MIT said that 34% of the IT professionals in Asia are working from home. Now that percentage is much higher now. In addition, 15% were already working from home. So you can imagine how much percentage of people are working from home, and they are the ones who are having either increased pain with a previous disorder or new pain in their neck, back, or shoulders. Now, why does this happen? I've seen this in case of many of my patients or even friends when I visited their house in the last 1 year, that most of them are working on laptop. They don't have a proper workstation. The table and the chair and the support for their laptop is not what they have in office because it's a makeshift arrangement. Either they did not have time enough to prepare for that, or we are just a little casual about these things. So what happens? You start using laptop in whichever way possible. You just use any table or you recline, you're playing with your family members, that time you start working. So this leads to very inappropriate body positioning or posture. And then you're working for longer hours. Rest of the time, what you do? Since you couldn't go out, you're sitting in front of the TV or you are accessing a mobile, or you're streaming. So most of the time we are sitting at home. In addition to this, there could be certain factors responsible for increased back pain. Being overweight, having previous disorders or issues, no physical activity, previously present spondylosis or other slip disc issues. Now, certain people are prone for this kind of problems. So if you already have a structural defect in your spine, it just worsens with this kind of activity. Bad posture, lack of sunlight, lot of higher physical and mental stress. Most of us are watching the news about COVID-19. That is giving rise to anxiety, something called as COVID-19 psychosis. Vitamin D, vitamin B12, calcium deficiency, and all stress-related emotional issues combined, they are resulting into higher incidence of back pain. So the first and foremost thing what we can do is take cognizance and reduce your sitting duration. So we can say that take a stand against sitting. Because if you sit for longer period, these problems are going to increase. Mind you, it also affects your heart, also affects your lungs. It reduces your fitness in general. So you need to stand up in between. It is all right even if you work while in sitting position for some time. It will definitely reduce your lower back pain by half. Now, another important thing is take a little bit of effort. Focus on the kind of chair are you using. Use your laptop as a desktop. Make sure the chair is closer to the table. And all this will go a long way in preventing your spinal issues. Many of us don't give attention to what kind of light that we are working in. As long as the screen is illuminated, we feel it is all right to work, but you're sitting in the position for a long time. You're straining your eyes, and the strain also comes your neck. And when the neck is strained, your back is also slouching forward. So make sure that you're working in proper lighting. Now, there is also increased incidence of spinal issues or back pain following somebody who had COVID infections. It need not be a serious infection landing in ICU or ventilator, because there is very obvious that the person will develop a lot of weakness, muscle pain, and back pain may be a part of his overall morbidity. But somebody who did not have a serious infection also can have persistent back pain. That can happen because of myalgia, muscle weakness, vitamin deficiencies, reduced nutrition, somebody who is forced to lie down in bed for some time, because all of us who had COVID infection were forced to take rest. And also sometimes the medicines can have an effect if you had any increased inflammatory problems following COVID infections, right? So if you have had COVID and increased back pain, also you need to take more care. Now there are certain conditions along with back pain and neck pain that I will strongly urge you not to treat this by yourself. So before embarking on the overall treatment, preventive and curative about back pain, first and foremost remember that these conditions are called as red flags. If you have any of this, don't treat yourself. Seek a professional opinion, a closest doctor or consultant who is a specialist. What are those? There is a neck pain, but the pain is also radiating along the arm, going into your hands, maybe associated with tingling or numbness in fingers. Similar pain going down the legs from the lower back. Losing control, passing urine or stools, or you are not able to stand upright. The pain is so severe that you're slouching forward, you're losing balance, you're not able to walk around, and you realize that there is a weakness in the foot. You're not able to stand properly or walk. There is a foot drop, or the strength in your hands is also reducing. If you have increased fever or night pains along with the neck pain and back pain, or you feel that the sensations around your perineal area is also reducing. There is a sudden loss of appetite or weight loss along with severe back pain, please seek a medical consultation. But for all those who do not have these issues, it is important that you start taking certain precautions or certain measures to treat yourself. First and foremost, improve your posture. I already told you a few tips about using a chair and laptop and others. There will be a session following this where my colleagues will demonstrate what will be a good posture and what are the good exercises that you can start doing yourself or under supervision for neck pain and back pain. Nutrition is extremely important. Your automobile can run as good as the fuel that you provide. This is true about your body also. So you have to give the vital nutrients like proteins, calcium, and vitamins to your body. Regular exercises is extremely important. Rather, this is the most important thing to remain healthy in your ongoing professional basis. Consultation whenever required. You need not visit your doctor. Most of us are doing online consultations nowadays because it's risky to go in a crowd in a clinic or hospital. Identify the red flags which I've told you, and do not hesitate to take a proper treatment if any intervention is required. Right? So if you see on the right side, it's very easy to remember the 7 ways to naturally relieve the back pain. All right. Now, what are the other things? Most importantly, do not sit or stand stationary. Even though you're working from home, go for a morning walk, go for an evening walk. If you feel outside there is a crowd and risk about COVID, go on the terrace. If nothing else, keep on walking around in your house, in the balcony. Rotate your neck, stretch your hamstrings. Make sure that every once in a while, every 45 minutes, 1.5 hours, get up, move around. Stretch your muscles which are under stress. Also, that will give you a little bit of rest to the muscles you are using while working. So there is an acronym BACK. Also, to naturally treat these problems, B means bust move. Get up, move around. Whether you walk, hike, use a cycle, stretch, dance, anything, but move your body, don't sit. Second, A for is for alarm. That means set up, either you can use an app for that or set up an alarm every 30 to 45 minutes. Get up, change your position, take a break. Third, C is for calm. Your rest is extremely important. Just like your gadgets, mobiles will not work without recharging, body has only one way of recharging, that is rest. So once in a while, you can also make sure that do not sit for a longer duration straight away, but take a little bit of relaxation break. Last but not the least is keep the environment ergonomically friendly for everything. I'm not just saying when you work, when you stand, when you walk, even when you sleep. The kind of pillow you use, the kind of mattress you use, the kind of chair with the support, everything makes an impact on your health and your spine. So when it comes to treating back pain, the first and foremost are the non-pharmacological options, treatment without using drugs. So physiotherapy and cognitive behavioral therapies. Here you need to meet a specialist therapist who can diagnose with an evaluation and tell you what you can start doing to treat your neck pain or back pain. Suppose there are modalities required. So there are modalities like TENS or transcutaneous electrical nerve stimulation or interferential therapy, along with manual therapies. Or sometimes if the pain is severe, we also use invasive procedures like the epidural injections. TENS is extremely useful. So remember, if the pain is not just relieving, with rest or use of home modalities like heat or ice packs, consult a therapist. Manual therapy is an extremely important technique nowadays, which is shown to have curative benefit. So if you're apprehensive of seeing a spine specialist or a surgeon, just go to a very good therapist. Most of the time it will work. There are also techniques called dry needling if there is an issue with a certain nerve getting pinched or muscle in spasm, and these modalities work wonders. If there are no red flags, please consult a good therapist. It will help you a lot. Now going back to ergonomics, here are just few tips. My colleagues are going to demonstrate. I'll repeat again. But here is what you remember. The kind of chair that you use, the distance of the chair to the table, height of the chair, armrest, the inclination of the monitor, all this plays a role. Your posture, how you're using it, also plays a role. Use the chair closer to the table so you don't have to swipe. And positional changes. That means do not keep on sitting for the long time. So these 3 P's are important. So this slide will tell you what is a good posture. Remember, the back angle changes the pressure on your discs. You must have heard about slip disc. People who sit for prolonged period tend to develop early wear and tear of the discs, leading to slip discs. So if you keep on slouching, the pressure increases tremendously. And the ideal posture is around 100 to 110 degrees. Not 90 degrees, but 100 to 110 degrees. But you need to keep on supporting your back when you work. Using a good chair, but not using the support and slouching forward is not good. As I will repeat again, I already shown, you need to take support, use the chair closer to the table, support your elbows, support your wrist, and this is a very bad way of using anything. right? I don't need to tell you what is wrong with this posture, but this is the ideal posture. The wrist should be neutral, supported, elbows on the armrest. See the inclination and the angle of the monitor, the distance of the chair from the table. Height of the chair should be equivalent to the distance between knee and the hip, knee and the heel. So all these will be repeated when my colleagues will demonstrate for you. Now there are simple things in everyday life. You see these two figures in between. The ideal posture when your spine is upright. The right hand kyphotic lordotic posture shows when your muscles are slouching, your tummy is out, where you're overweight, you're standing casually. Your spinal curvatures, they change, producing more stress on your discs, on your bones, on your muscles, and they tend to get fatigued, resulting back pain. One common question I get asked all the time, especially from the ladies, is there a problem with high heels? Yes, of course there is. You can see the slightest heel also produces more strain on your spine. If you use 1-inch heel, it adds 22% more weight. If it goes to 3 inches, it adds additional 76% load on your disc, leading to increased lordosis, bad posture, more strain, and it makes you more prone for slip disc or back problems. This is a common thing. I think looking down and using the mobile is our national posture today. Even if you're on the street and near signal in the bus, you'll see people all the time. See over here, if you're tilting your neck, how much increased load it brings on your neck. 0 degrees is just 10 to 12 pounds, and if it's 60 degrees, it increases 5-fold. So make sure do not use mobile in the wrong way and don't use it continuously. So everywhere there are good postures and bad postures, even standing also, sitting also. I already mentioned that if you're working from home, once in a while stand and use your laptop in this fashion. There, make sure that you're offloading one foot or one leg alternatingly. So don't stand with both feet all the time. Keep a platform, use a footrest, and keep on changing it. Rest your wrist, support your elbows at times, and this is a very good way of offsetting the complications of sitting for a long time. Most importantly, take frequent breaks, position changes. Every half an hour to 45 minutes, get up, stand for a few seconds, move around, walk. Every 2 hours, at least stretch your body. Move your hands in shoulder circles, neck rolling, up and down, stretches of the shoulders. Breathe deep, exhale, something like short pranayamas. So all these things will increase the circulation in your muscles. You can also get up and do short squats, as you see this gentleman over here. This increases the circulation in your muscles, prevents stiffness and eventual problems with the neck and back. Most important, but equally forgotten, we are not giving sufficient attention to body weight. Especially in the last 1 year, most of us are focusing on good nutritional food, but we are doing it in excess because our activities are low. If you are obese, if you're overweight, you have higher tendency for developing neck pain and back pain. So what is good food? Proteins, calcium, essential nutrients like vitamins has to be good. Don't go for any crash diets. Don't be extremely fanatical about keto diets and the rest of the things. Make sure your input and output of calories is balanced, and most importantly, eat proportional to your activities and caloric output. So what are the good foods for your neck and back? Those which are good for strong bones. Calcium is excellent in milk products, green leafy vegetables, and also vitamin D with it. Remember, you have to go out in the sunlight for that. But if you are a vegetarian, make sure you have fortified cereals or sprouts. And if you're non-vegetarian, fish and eggs are extremely good for this. But vitamin D is synthesized in our body provided we expose to the tender sunlight early morning and evening for sufficient time. There are receptors on your forearm which increase natural vitamin D. But if you don't go out, then we lose vitamin D. That reduces the absorption of calcium, that increases osteoporosis. Already we know that women and elderly people are prone for osteoporosis. Now, is it sufficient just to relieve the pain? If you want to be healthy in future, neck and spine pain should be avoided, so you have to be fit. So what is fitness? It is related with your health, related with the kind of occupational skill that you're doing. For an example, if I'm a doctor, if I'm standing and operating for a long time, I need to have very good core muscle strength. I need to have subtlety in my fingers. I need to have good agility and balance coordination. So based on your profession, your fitness level should be different. Based on your age, it should be different. Based on the requirement of personal life, it should be different. But by and large, we need to be fit if you want to provide this. Just absence of pain doesn't mean you're fit. So in addition to the measures which I have told you, you need to do regular exercise. Commonest exercise to start, if you have any bout of neck pain or back pain, are the stretches. Again, my colleagues will tell you in detail about this. The second set of exercises which are safer and to be done, especially if you're tending to be above 40 years, are stretching exercises and flexibility exercise. The best flexibility exercise are the yoga exercise. So again, there will be demonstrations later. If you go forward, you want more than stretching and flexibility, you want endurance and you want strength in your muscles. You want more stamina to work for 8 hours, 12 hours. One of the ways is doing core strengthening. Pilates is just one way of increasing the core strength in your muscles. Another way is functional training. Don't go to the gym and all. You can do this with simple gadgets even at your home. Now, as you know, the gymnasiums are still not open everywhere. So it's worthwhile learning yoga, Pilates, functional training, doing it at home yourself. If you still want to increase your fitness, yes, there are high intensity exercise, but I will not recommend you for a preliminary beginning. So to stress in the end, what I have tried to told you are what are the common problems due to which during COVID-19 we are developing neck pain, back pain. I'm also watching that suddenly in the last 1 or 2 months, there is a surge of patients in the outpatient department. A lot of patients are coming with increased symptoms because we have avoided going and taking consultation. We have done a little procrastination because we were, rightly so, we were apprehensive of stepping out and taking the risk about COVID. But start taking these measures at home, watch for red flags, slightest of doubt, do online consultation. If you feel the pain is not going, do not hesitate from going to a doctor and taking a consultation, but make an effort to remain healthy. And health is a status, it's a state of lifestyle, and you cannot buy it. You have to make an effort every day, and you can earn it through healthy living. Thank you so much. Are there any questions now that I can answer? So till any new question comes up, there has been a query. What care should we take in unlocking era? I've told you what happens when you have work from home, you're stationed at home, but what happens during unlocking? Now there is a sudden change in the lifestyle. People are stepping out and they are trying to make up for the lost time. You'll see the crowds outside. People are stepping out, going to these stations, or trying to get back to work with vengeance. It even happens to us doctors that we want to go back and work a lot. So just a word of caution. First of all, make sure you don't have pain. Start exercising, start stretching, develop ideal lifestyle, and step up your work schedule gradually. Now, there is a question from Mr. Deshpande. Does stress cause back pain? Yes, of course. Now, stress can be emotional, mental, it could be physical. Each kind of stress has a very close proximity or linkage with back pain. How does it cause back pain? Suppose you're stressed out because of professional demands, you haven't had enough sleep, you're sitting for all the time, and all the time you're thinking, it causes spasm of your muscles around the spine. Eventually, that spasm leads to reduced circulation and nutrition. It alters the curvatures of your spine. So even everyday activity, the stress across the spine is transmitted in an unhealthy way. There is more loading of your discs than proper dissipation through the muscles. Many a times you will see when you're emotionally stressed or professionally stressed, these muscles tend to stiffen up. You can even feel knots or you can feel some nodules, and slightest of movement also becomes painful. So there is a very close proximity of muscle spasm to stress to altered curvature of the spine, leading to wear and tear and degeneration. So here, the treatment of such back pain is not just to relieve the pain or with analgesics and muscle relaxants. It is also by stress relaxation, which again my colleague is going to speak later on. Now, there is another question. How can I heal spinal pain naturally? Now, I answered part of it, but again, let me stress here. If you want to naturally heal any spinal pain or disorder, first and foremost, identify that there is no serious issue. So suppose you have neck pain or back pain. First of all, make sure that there is no associated radiating pain going to the arms or legs along with the neck or back pain. There is no tingling, numbness, imbalance, weakness, muscular weakness, inability to walk for a long time, or difficulty in passing urine stools. If there is no such issue, then only you treat it naturally. First of all, improve your posture, take rest, use ice packs or heating pads at home. Avoid stressful situations. Make sure that you're using your work, laptop or chair, whatever you're doing at home properly. Still, if there is pain, you can try analgesics, muscle relaxants from your doctor. If still it is painful, then ask the therapist. फेसिंग इश्यूज हर 15-20 दिन के बाद बैक पेन होता है, क्या करें? इस तरीके के क्वेश्चंस और कंप्लेंट्स काफी कॉमन है सर। हर 15-20 दिन में अगर आपको तकलीफ हो रही है, कमर में दर्द हो रहा है, इसका मतलब आपको क्रॉनिक बैक पेन है। आपको ये देखना पड़ेगा कि क्यों हो रहा है। हर बार हर 15-20 दिन में कोई ज्यादा लोड आ रहा है, आप झुक के काम कर रहे हो, वजन उठा रहे हो, या आपका काम ही इस प्रकार का है कि कमर पे लोड आ रहा है, तो आपको वो अल्टर तो करना ही पड़ेगा। लेकिन अगर पेन सीवियर है तो बेहतर है कि आप पहले इन्वेस्टिगेट करो। हो सकता है आपको एक एक्सरे या कुछ ब्लड टेस्ट की जरूरत हो, आपके विटामिन चेक करो, आपका प्रॉपर पोस्चर और सही तरीके से आपके काम में आपका पोजिशनिंग जरूरी है। उसके बावजूद पेन होता रहा तो आपको देखना पड़ेगा कि उसका कारण क्या है। या आपका वजन ज्यादा है, या आपको कुछ विटामिन डेफिशिएंसी है, या अंदर गद्दियां घिसना चालू हुआ है, आपको स्पॉन्डाइलोसिस है। तो आपको सिर्फ नेचुरली खुद हीलिंग करने के बजाय थोड़ा सा इवैल्यूएट करके उसका ट्रीटमेंट करना जरूरी है। इसके बावजूद शायद आप सिर्फ एक्सरसाइजेस और थेरेपी से ही ठीक हो जाओगे, बट प्रॉपर पोस्चर, जरूरत पड़े तो कुछ एक्सरसाइजेस और प्रॉपर डायग्नोसिस, इसकी आपको बहुत जरूरत है। कुछ ऐसी कंडीशंस भी होती है जिसमें हर 15-20 दिन के बाद दर्द होना कॉमन है, जैसे कि कैल्शियम डेफिशिएंसी, ऑस्टियोपोरोसिस, अंडरलाइंग आर्थराइटिस जैसे सेरोनेगेटिव आर्थ्रोपैथी, या तो फिर विटामिन डेफिशिएंसीज आर रिलेटेड टू मैल एब्सॉर्प्शन सिंड्रोम। आप सपोज अच्छा खा रहे हो, सप्लीमेंट्स ले रहे हो, लेकिन पेट की खराबी है या अंडरलाइंग कुछ प्रॉब्लम है, डायबिटीज है, तो ये सब देखना पड़ेगा। अगला क्वेश्चन है, सर पीठ दर्द के लिए योगा करना कितना फायदेमंद हो सकता है? बहुत फायदेमंद हो सकता है। रादर आप देखोगे कि हमारे काफी एक्सरसाइज जो है, जो थेरेपिस्ट बताते हैं, ये योगासना से काफी मिलते जुलते हैं, उनसे ही थोड़े बहुत डिराइव भी कर चुके हैं हम लोग। लेकिन मैं वापस दोहराना चाहता हूं कि हर पीठ दर्द सिर्फ योगासना से ठीक हो ही सकता है, ऐसा नहीं। जैसे किसी का पीठ दर्द सिर्फ बायोमैकेनिकल पेन के कारण है, मसल स्टिफनेस के कारण है, ज्यादा बैठने के कारण है, और किसी के पीठ दर्द के कारण की मीमांसा करना जरूरी है। अंदर ट्यूबरकुलोसिस है, या इन्फेक्शन है, या हड्डी घिसी हुई है, या ऑस्टियोपोरोसिस है, कोई हड्डी दबी हुई है, तो पहले ये रूल आउट करना है कि कोई योगासना करने के लिए कॉन्ट्राइंडिकेशन तो नहीं है। एक एक्सरे और एक्सपर्ट ओपिनियन जांच कर लो, डायग्नोसिस करो, और फिर वो आपको बताएंगे कि कौन से योगासना करने हैं। जैसे कि किसी को अगर स्लिप डिस्क की शुरुआत है, नस पे दबाव नहीं लेकिन डिस्क घिसी हुई है, तो आगे झुकने के जो योगासना होते हैं, जैसे पश्चिमोत्तासन हुआ, उसमें ज्यादा लोड आके स्लिप डिस्क खराब हो सकती है। उसमें एक्सटेंशन के आसन जो है, जैसे भुजंगासन है, अर्धचक्रासन है, वो ज्यादा फायदेमंद होते हैं। तो जरूरी है कि आप पहले डायग्नोसिस करो और फिर योगासना जरूर फॉलो करो। मेरे पास कई पेशेंट्स ऐसे आते हैं जो सालों साल योगा कर रहे हैं, फिर भी उसके बावजूद उनको स्पाइन में प्रॉब्लम होती है, स्लिप डिस्क होती है, कई बार नस पे ज्यादा दबाव आता है। जैसे 3 महीने पहले ही मैंने एक योगा टीचर थे, उनकी सर्जरी उनको करनी पड़ी, तो उनको वही क्वेश्चन होता है दिमाग में कि मैं इतने साल योगा कर रहा हूँ फिर भी ये तकलीफ मुझको क्यों हुई। तो एक बात ध्यान में रखिए आप कि घिसावट होना, स्लिप डिस्क होना, स्पॉन्डिलोसिस होना, ये एक शरीर में बदलाव है। कोई भी ऐसी चीज नहीं है कि हरदम आप सालों साल चिरतरुण रहोगे या हरदम उतने ही जवान रहोगे, फिट रहोगे। दूसरा, फिटनेस के लिए फ्लेक्सिबिलिटी, एंड्योरेंस, स्ट्रेंथ एंड कोऑर्डिनेशन, चारों चीजों चाहिए। सिर्फ किसी एक टाइप के एक्सरसाइज से सब कुछ नहीं होता। तो इसीलिए आपके प्रोफेशन के अनुसार आपको मल्टीपल चीजें भी शायद करने की जरूरत पड़ेगी। दूसरा, न्यूट्रिशन, प्रॉपर लाइफस्टाइल, स्ट्रेस रिलैक्सेशन, प्रॉपर रेस्ट, और आपके शरीर के अनुसार ये सब एडजस्टमेंट्स, प्रोफेशन के अनुसार ये सब एडजस्टमेंट, ये भी जरूरत है। किसी एक चीज से आप हमेशा फिट रहना ये संभव नहीं है। अगला क्वेश्चन है कि लोअर बैक पेन है, वर्कआउट करने के बाद बहुत दुखता है, व्हाट टू डू नाउ। ये थोड़े सीरियस प्रॉब्लम हो सकता है क्योंकि आप वर्कआउट कर रहे हैं उसके बावजूद आपको दर्द बढ़ रहा है। तो सीधी सी बात है, सबसे मैं पहले बोलना चाहूंगा कि आपके लोअर बैक पेन का कारण क्या है, उसका डायग्नोसिस ठीक से हुआ है कि नहीं हुआ है, और जो वर्कआउट आप कर रहे हो वो बैक पेन की जो वजह है उसके अनुसार सही है कि नहीं है। ये दो चीजें जरूर देखिए। लोअर बैक पेन 75% या 80% टाइम्स यंग एज में बायोमैकेनिकल पेन होता है। तो किसी प्रकार का स्ट्रेस, बैठने की या काम करते समय शरीर की पुअर पोस्चर, न्यूट्रिशनल डेफिशिएंसीज एंड अदर फैक्टर्स, जैसे आप ओवरवेट हो या मसल्स वीक रहे, इसके कारण होने का चांस ज्यादा है। न्यूट्रिशनल डेफिशिएंसीज के कारण होता है। बट आप वर्कआउट कर रहे हो तो सबसे पहले आई मस्ट कांग्रेचुलेट यू कि आपने पहला स्टेप तो लिया। वर्कआउट आपने चालू किया, इसका मतलब यू आर वेरी अवेयर अबाउट योर हेल्थ एंड यू आर विलिंग टू टेक हार्ड एफर्ट्स। तो प्लीज वो कंटिन्यू तो आपको करना है, वर्कआउट छोड़ना नहीं है। सिर्फ ये देखना है कि कौन से टाइप का वर्कआउट आपको करना है। जैसे कि सब समझो आपको बैक पेन है और आप जिम में जाके रेजिस्टेंस ट्रेनिंग कर रहे हो, डेडलिफ्ट्स, लंजेस, स्क्वाट्स ऐसे कर रहे हो, अगर वो आपका वर्कआउट है तो सही नहीं है। दूसरा, एरोबिक एक्टिविटी में स्किपिंग, जंपिंग, रनिंग कर रहे हो तो उसके बजाय बेहतर है कि आप ब्रिस्क वॉकिंग करो, जिसमें आपके लोअर बैक पे ज्यादा स्ट्रेन नहीं आएगा, धक्के नहीं लगेंगे, डिस्क की घिसावट नहीं होगी। साइकिलिंग और स्विमिंग भी बहुत अच्छा एक्सरसाइज है। तीसरा, वर्कआउट के बावजूद कभी कभी दर्द होना, ये विटामिन डेफिशिएंसी, कैल्शियम डेफिशिएंसी से हो सकता है। हड्डियों में या गद्दियों में अगर आर्थराइटिस है, स्पॉन्डाइलोसिस है, उसकी वजह से हो सकता है। तो कुछ एक्सरे और ब्लड टेस्ट करके एक्सपर्ट को एक बार दिखाना इज अ गुड इन्वेस्टमेंट फॉर फ्यूचर, और वो आपको बताएंगे कि कौन से टाइप वर्कआउट आप चालू करो। कई बार अगर पेन सीवियर है तो हम लोग एडवाइस करते हैं कि पहले स्ट्रेचेस चालू करो, पोस्चर सुधारो, दर्द काफी हद तक कंट्रोल करो, और जैसे दर्द कम होते जाएगा वैसे फिर आप एंड्योरेंस एक्सरसाइज, एरोबिक एक्सरसाइज एंड फाइनली फिर रेजिस्टेंस मतलब स्ट्रेंथनिंग एक्सरसाइज आस्ते आस्ते बढ़ाते जाइए। ये सब में वेट ट्रेनिंग और रेजिस्टेंस एक्सरसाइज सबसे एंड में आता है। कई बार लोगों को लगता है कि वर्कआउट मतलब डायरेक्टली मैं जिम में जाऊं और वजन उठाना चालू करूं उससे ही फिटनेस आएगा। ऐसा बिल्कुल नहीं है। लीन मसल होना और फिटनेस ये ज्यादा इंपॉर्टेंट है, बल्कि आप बहुत मस्कुलर और बल्की मसल्स जिम में जाके बना रहे हो, आपके प्रोफेशन के अनुसार आपको क्या जरूरत है उस हिसाब का वर्कआउट आप प्लान करो। ज्यादातर एक हफ्ते में 5 या 6 दिन से ज्यादा आपको वर्कआउट नहीं करने चाहिए, एक आध दूसरा रेस्ट डे चाहिए। आपका कोई भी वर्कआउट एक कॉम्बिनेशन होना चाहिए, स्ट्रेचेस या थोड़ा योगा, एरोबिक एक्सरसाइज मतलब वॉकिंग, स्विमिंग, साइकिलिंग, एंड तीसरा थेरेपी एक्सरसाइज और बाद में जिम की एक्सरसाइज जिसमें आपका एंड्योरेंस और स्ट्रेंथ की बिल्ड हो। Next question is, can young people get spondylosis and can work from home cause this? Well, simple as answer to both questions is very much so. Very true. Yes, young people do get spondylosis. The term spondylosis itself indicates that there is wear and tear of the spine. Spine has multiple components, the discs, the vertebrae, the facet joints, and ligaments. So even in younger age, nowadays we are seeing patients with wear and tear of these structures. Why so? Age is just a number. Chronologically, if somebody is 50 years, we used to believe that after that the spondylosis used to start. But if you're doing more work, even a 25 or a 30-year-old has used his spine for 10, 15 years, working in a way that there is more load on spine, it can undergo wear and tear. So his physiological age of the spine is much more than his chronological age. So spondylosis can occur even in younger people. It is usually misuse, disuse, or abuse of the spine. Improper posture, too much loading, lack of exercise, and other factors like obesity or bad habits like smoking and all, or too much work, lot of stress, all this can lead to even spondylosis in younger people. Can work from home cause this? Very much so. Working in office with proper ergonomically designed furniture, we are minimizing the chances of wear and tear of the spine, but we can never nullify it completely. But if you especially see work from home, percentage-wise, there is a higher chance. Why so? Because even though we try, we cannot recreate exactly the same kind of ergonomic workstation as the office. Some people can, some people are not able to, some people are casual about it, or some people just assume that this is ideal, but they have not tested it or taken any professional consultation. Other factors from work from home, I have seen last 1.5 years, more so in women. When a man works from home, rest of the time he's resting. Women who are working from home, they are still doing the work. They are the homemakers. Plus, additionally, the maids and the servants, they were not working. They were not visiting because of the curbs, because of the lockdown. So they were doing more work at home. Plus, they are doing professional work from home. Second, many IT employees, they're working for longer hours. Instead of 8 hours, quite a few of them were 10 to 12 hours. More than this, sudden change in the lifestyle, lack of sunlight, lack of outside exposures, being in the same position all the time, the same four walls, lot of stress, either COVID psychosis, listening to the news, lot of morbidity, losing family members, having COVID infections, altered nutritional issues. So it's a composite of all these factors that work from home has led to more stress on your spine, more wear and tear of the disc in the neck and back, which is known as spondylosis. Another question. I have gap in my lower back and I have diabetes as well. So can I go for walk for how much time? Gap in the lower back is a very loose layman's term, usually indicating that there is a slip disc. The gap which doctors mention is in between the adjacent vertebrae, which indicates the normal discs. When the gap is less, or when we say there is a gap, that means there is a wear and tear of the disc. which if it increases, we call it slip disc. This usually causes pain in the back, or if there is pressure on the nerve, the same pain can go down the legs as well. In addition, if somebody has diabetes, it complicates the situation a bit. Usually, diabetes tends to reduce any pain sensation. So we may come to know about the slip disc and the pressure on the nerve little later than a person who doesn't have diabetes. Diabetes itself can cause change in the cover of the nerve, something called as neuropathy. Diabetes is also associated with some change in the metabolism. It is having a higher occurrence of vitamin deficiencies, poor nutrition, and other complications. So diabetics have a higher tendency of nerve complications. So you need to have more effort to remain fit. The easiest way that you can control sugar is by physical activity, and walking is one of the best ways. So yes, you can go for walk, provided your back pain is not very severe. What you are saying as the gap is not indicative of something more severe. That means as long as it just wear and tear of the disc is fine. But if it is also indicative that one bone has gone over the other, which is called as discs, or if there is too much pressure on the nerve, then walking may not be a good option in the initial stages. Stretching and certain exercises which you can do lying down at home may be a better option. And once it is under control, then you can start going for walks. How much time depends entirely again on the severity of the pain, your age, your weight, whether you have other problems like knee, osteoarthritis, wear and tear, etc. On an average, walking for 25 to 30 minutes every day is an extremely good thing for your health, for your heart, also to control sugar. At a speed of 5 to 6 kilometers an hour, if you walk for up to 3 kilometers, it's extremely good as a cardiac exercise. But if you have pain, it is not advisable directly to start walking for half an hour. Start with 10 to 15 minutes. Walk more frequently. That means you walk little in the morning, little in the afternoon, little in the evening, rather than continuously, and then go on increasing the duration till at least you walk half an hour. There is another question. Whenever I start a workout or walking, in the night, it feels too much pain. Last 3 times, I skipped workout after 1 or 1.5 because of this. Is this sign of any danger? Right? Now, I will refrain from giving a very affirmative answer till we can actually evaluate what is the reason for pain. Right? But it is not unusual after a workout or long bout of walking to get pain at night because your body is tired, your muscles are stiff. If you have not done enough stretching after a workout, or if you have not done proper care of warming up previous to the workout, you can get pain in the night. But when you say too much pain, if it is only in the back or in the legs also, you need to evaluate 2 things. Whether the pain is a result of something structurally wrong in your spine, like a slip disc, a stenosis, or listhesis, or wear and tear, osteoporosis, or poor musculature, or you're doing a workout which according to your physical condition is in excess or inappropriate. For example, if there is a lot of pain afterwards, I will strongly suggest that you focus more on warming up, stretching till the pain goes off, then do endurance activity, flexibility, yoga, rather than doing resistance training, weight training, or impact or high intensity exercises. Even working with an instructor or a therapist under supervision will be a better option, and then go on increasing gradually the duration of exercise or the kind of exercise that you do. It may not be a sign of big danger, but be extremely prudent, get it diagnosed in proper time, and take concrete steps to rectify the kind of work that you're doing. But please don't stop exercising. till the next question comes. If you are not feeling pain while walking, when you are doing your workouts, that's a good sign. Because if there is structurally something very wrong, you won't be able to do the workout only, right? But get it evaluated. Next question is, back pain के लिए कौन सा belt use करें? First and foremost, I do not encourage using the belt for back pain. If I see 100 patients for back pain, maybe just 1 or 2 need a belt. Remember, back pain is a result of poor musculature, less exercise, or something else inside, which the belt is not going to solve. Belt is just going to support it temporarily and make it straight to remind you to keep it appropriate. That's how it works. So suppose there is a serious problem inside like slip disc or infection or something, belt is not going to use, right? But why do we use even less percentage? To give a temporary respite. So if you have an instability, that means the vertebrae are moving on each other, or the pain is so severe that you cannot even do any commuting from one place to the other. Temporarily you may use, you undergone surgery, you may use, you have had any injury or a fracture, and then the fracture is not completely healed, but you need to start moving around. That's the time to use the belt, right? So usually, if it is only lower back pain and very intensity that transiently you need to use, or after surgery, we use a belt called as lumbosacral corset or LS belt. But if it is a fracture, that too in a thoracolumbar area, that means the junction between the higher back and lower back, we use a belt which is a hyperextension belt or Taylor's brace. Again, I will tell you that if you have chronic back pain, if you do not have that intensity, avoid using belt, because using belt, you're actually relying on external support that will weaken your muscles. If you need to develop good strength in your arm muscles, you need to do exercise. If you just keep it like this and put a belt from outside or a support or a brace, it will weaken. So same way, using a belt for the back pain for longer duration is counterproductive. आप ऐसा belt avoid करो. बेल्ट यूज करना अच्छी चीज नहीं है. बेल्ट यूज करना है क्या, सिर्फ स्पेशलिस्ट बताएगा, वो भी टेम्पररी कुछ दिनों के लिए ही यूज करना है. अगर फ्रैक्चर हो, सर्जरी हो चुकी है, बहुत ज्यादा दर्द है, कि ट्रैवलिंग करना है, तो ही बेल्ट का यूज किया जाता है. कमर के लिए एलएस बेल्ट और ऊपर के लिए टेलर्स ब्रेस. बाकी के भी तरीके हैं, बट इन जनरल लोअर बैक के लिए उसको बोलते हैं एलएस कॉर्सेट. सिमिलर क्वेश्चन मुझको कॉलर के बारे में भी पूछा जाता है कि गर्दन में दर्द है तो सर्वाइकल कॉलर यूज करें क्या. मैंने आज तक कॉलर से फायदा होते हुए ज्यादा नहीं देखा है, नुकसान होते हुए बहुत लोगों को देखा है. अगर बहुत ही सीवियर नेक पेन है, हाथ में पेन है, चक्कर आ रहे हैं, तो ही कॉलर यूज किया जा सकता है. बट ज्यादा अगर आप कॉलर यूज करोगे तो गर्दन स्टीफ हो जाएगी, मसल सारे वीक हो जाएंगे, और फिर साइकोलॉजिकली इतना डिपेंडेंस आ जाता है कि ये लोगों को जिंदगी भर यूज करना. The next question is, whenever I wake up, there is this burning pain in the back part of my neck. Why does this happen? Usually, when you wake up, there is a change in the posture, change in the circulation, and also change in the loading on the muscles of your neck. Many a times, that sudden change can bring about a disparity between the blood supply and the demand. And you may experience stiffness, which is a very common thing in the early morning. Burning pain is not such a common thing. That pain, very few people describe as a burning pain. But usually burning pain, which we call as causalgia, is a sign of reduced circulation, reduced vitamins. It is common in diabetics. It is also common if you are working for a very long duration and these muscles are undergoing a lot of spasm. So when you get up and the muscles are in spasm, there is less blood supply reaching there and you may get burning pain. So check your vitamin levels and consult a physician or a specialist before embarking on certain stretching and exercises and postural correction. But I'm quite sure with just a few supplements and exercises, your problem will go completely. If there is a pain early morning when you wake up, you also need to check on the kind of pillow that you are using. One of the commonest causes of neck pain is improper use or using an improper pillow. Remember, most of the time when we sleep, if you're using pillow, the neck is remaining in a bent or flexed position. That is not good for the neck. So ideally, when you lie on your back, your neck should have only a thin pillow or no pillow at all. But you lie on your side, you need a pillow to make up for the distance between your shoulder tip and neck. If the pillow is less, it will remain tilted. So make sure your posture during sleep is proper. Next question is, my sister is the student of 12th standard. She is facing a severe back pain because of studying throughout night. Can you suggest any treatment or medicine for the same? Most of the time, somebody who's on 12th standard, somebody who's just 16, 17 years of old or 18 years of old should not have neck pains or back pain. This is a typical sign of stress-related or biomechanical pain because she's sitting for a very long time. That too, probably continuously in the same position, without a break, without getting up, because she's studying night, you don't tend to get up, go around, walk, everything is closed. So first and foremost, ask her to sit with a proper chair, with back properly supported. Every 30 or 40 minutes, get up, move around. Third, make sure she has proper hydration, proper nutrition, proper proteins, calcium, and vitamins in her diet. Next, every 2 hours, she should do few stretches. In my presentation, I already shown a few. Later on, my colleagues will demonstrate. So these are the first steps she should take. In spite of this, if she keeps on having pain, please consult a specialist, get her X-ray and few blood tests, namely check her vitamin D, vitamin B12, give her protein supplements, calcium-rich diet. Maybe it is better after diagnosis to consult a specialist and start appropriate workout. This is a problem again we face so many times in college-going students or exam-going, that there is so much stress about giving exam that you don't give particular attention to your nutrition and posture when you're studying. There is also a tendency that when exam is near, suddenly you sit for 12, 16 hours a day and keep on studying. Make sure that especially around these times, your eating habits are proper, your stress levels are normal, and you are taking care of your back and your posture. Next question is, can vitamin D injections reduce back pain? If the cause of the back pain is vitamin D deficiency, definitely vitamin D injections will help. Now, how does vitamin D deficiency cause back pain? Vitamin D is extremely important for the absorption of calcium. Vitamin D also acts like a hormone. It has effect directly on the muscles, effect directly on the bone metabolism. In the absence of sufficient vitamin D, you tend to have reduced strength in the muscles, less calcium in the bones, less energy levels. It also reduces your willingness to work hard. It can give rise to depression, reduce muscle tone. So all this can result into back pain. But if you want to inject somebody vitamin D, it is better that you check the blood vitamin levels, because vitamin D is also a vitamin, if in high amounts, can cause toxicity. It's a fat soluble vitamin. So if somebody has another reason for back pain and his vitamin D is normal, and if you do injections, you can cause more harm than any good. So check the vitamin D levels. If the vitamin D levels are deficient, less than 10, it is better to give injections. If it is just insufficient, that means less than 30 but not very deficient, you can also give oral tablets or oral liquid or even oral powder which you can dissolve and give for vitamin D supplements. The usual dose for deficiency is 60,000 units orally per week. If you're giving injections for an adult, depend on the deficiency, you can select how much you want to give. Next question is, can back pain be a symptom of COVID? Yes, if you have read during 1 year in the itinerary or the alarms that were given by healthcare workers. Watch for this, watch for that. Along with the breathing issues, back pain was also one of the initial symptoms of COVID. And if you are COVID positive, if you ask people who have had COVID, how many of them got back pain? A huge percentage of patients got back pain. Number of reasons. COVID itself causes myalgia, some change in the muscle metabolism. It also brings about weakness. It also results in the patient being recumbent or bedridden. That gives rise to back pain. The medicines given for somebody who is COVID positive, who is in ICU or indoors, also gives rise to weakness and cause back pain. So there are a number of reasons why COVID can bring about back pain. Even isolated back pain or muscle spasms without anything was also a presenting symptom of COVID in certain number of patients. If somebody has breathing difficulty, lung affection because of COVID, hypoxia or reduced oxygen percentage itself can be a reason of body pain, weakness, and back pain. Next question is, क्या बैक पेन के लिए होम रेमेडीज काम करती है? ऑफ कोर्स करती है. जैसा मैंने ऑलरेडी बताया कि 75 या 80% लोगों को जिनको बैक पेन है उनको बायोमैकेनिकल बैक पेन होता है. उसका मतलब है कि रॉन्ग पोस्चर या स्ट्रेस के कारण बैक पे लोड आके तकलीफ हो रही है. ऐसे पेशेंट्स ज्यादातर होम रेमेडीज से ही ठीक हो सकते हैं. सबसे पहले रेमेडी होती है लोड कम करो, रेस्ट करो, स्ट्रेचेस करो, आइस या हीट का इस्तेमाल करो, मसाज या ऑइंटमेंट भी ठीक तरीके से किया तो हो सकता है. आपका पोस्चर सही करो, बैठने का, सोने का, काम करने का जो अंदाज है, जिस तरीके से आप आपका शरीर इस्तेमाल करते हो, उसमें इंप्रूवमेंट होनी चाहिए. दूसरा, खुद ब खुद दवाई लेना तो अच्छी चीज नहीं है. आप किसी को ऑनलाइन कंसल्ट करके घर में ही एज अ होम रेमेडी कुछ चीजें कर सकते हो. मेनी टाइम्स यू विल रियलाइज कि स्टीम या सोना या थोड़ा हीट और मसाज, इससे ही काफी हद तक फर्क पड़ता है. पोस्चर अगर आपने बदल दिया, जैसे कि बैक पेन है, आप अच्छे मैट्रेस पे लेट गए, घुटने मोड़ के आपके थाइस के नीचे एक दो पिलो रख के आप सो गए, साइड पे सो गए, तो पोस्चर बदली करके ही काफी हद तक बैक पेन कम होता है. जहां पे लोकलाइज पेन है, आइस पैक से हीट लगाया तो भी कम होता है. स्ट्रेचेस, अगर आपको पता है पहले एक दो बार बैक पेन हो चुका है और तब स्ट्रेचेस से फायदा हुआ था, तो ऐसे स्ट्रेचेस से काफी हद तक आपको पड़ेगा. मेडिसिन ज्यादातर बैक पेन के लिए दिए जाते हैं, वो होते हैं मसल रिलैक्सेंट्स एंड एनाल्जेसिक्स या पेन किलर्स, जिसमें नॉन स्टेरॉइडल एंटीबायोटिक ड्रग्स काफी हद तक काम करते हैं. बहुत रेयरली हम लोग ओपियोइड्स देते हैं. क्वेश्चन ये वापस आया है कि कैन यंग पीपल गेट स्पॉन्डिलोसिस एंड वर्क फ्रॉम होम कॉज इट? वेरी मच सो. There are a lot of people I have seen as part of consultation, and so far I have treated them who were young and who are wear and tear of the spine. That resulted from inappropriate or wrong use of the spine. Spondylosis is wear and tear of the spine. What can cause it? Not just aging, but excess use, even at younger days, and inappropriate use. So this is extremely common when you are working from home. Usually in a professional place, even the industries, the companies are very careful in giving you a proper workstation which is ergonomically designed. With a lot of research and previous experience, people know what should be the ideal chair, what should be the ideal height of the table, how the monitor should be, what should be the distance. But when you're working from home, we tend to take these things a little casually. Without appropriate stress on these things, if you misuse or wrongly use your body, then it can result into some kind of wear and tear which results in spondylosis. Okay. So we are almost close to end of the session. So I will invite only one last question before we go on to the next session, which is about problems of spine in elderly and women, and later on the demonstration about posture exercises, which is the most important in all these discussions, because you will actually get to see therapist explain to you how to sit, what to do, what not to do. So any last question? So if there is no last question, can we close the session, please? And we can go on to the next session. Yeah, there is a last question. How to get immediate relief from back pain? It's very important. Sometimes it can happen when you're working at home or when you're elsewhere, where you're traveling, and there is a sudden jerk, sudden spasm. First and foremost, try to rest. Break the movement, change the posture. Suppose you're bending and lifting, sudden pain comes, try to lie down, achieve a position of comfort. Sometimes the position of comfort is lying on your side in a fetal position with knees bent. Try to relax your muscles. Second, ask for a heating pad or hot water bag or ice pack. Try to put it in the painful area. Third, if you have access to any ointment, apply it. Next, try to assess whether the back pain is also causing any other symptoms like pain going down the legs, tingling, numbness, or is it something associated with upset stomach or something else? Call your friend, help at hand. If you have any access to any doctor, call them, take an online consultation if it is severe pain. If not, rest is helping you. Go to sleep, avoid any exertion, avoid sudden getting up, identify the cause of pain or the posture and avoid it. If you have any access to, if you know the stretching exercise, if you have this bout in the past, you may try it. Otherwise, abstain from doing anything which is unknown. Don't suddenly try to push your body. Somebody has said, do this posture, do this stretch, and it relieves. No, that could be dangerous. It can worsen. Ask for a professional opinion. If you know that certain medicine helps you, if you've taken it in the past and your doctor advises you online consultation, you may take it. But changing posture, rest, local therapies, hit ice, having an appropriate position, and calling for professional help or help at hand. That is the best way of immediate relief for back pain.
पेशंटच्या अंडरस्टँडिंग बाकीच्या गोष्टीसाठी मराठी आणि जिथे नाही कळणार तिथे मराठीमध्ये आपण घेणार आहेत. मी डॉक्टर सचिन पाठक, ऑर्थोपेडिक स्पाइन सर्जन, सह्याद्री हॉस्पिटल, पुणे. ड्यू टू कोविड पॅन्डेमिक मोस्ट ऑफ अस आर वर्किंग फ्रॉम होम. हा साधारणतः लास्ट लॉकडाऊन जो 3 महिन्याचा होता त्याच्यामध्ये एव्हरीबडी वॉज हॅपी की घरातनं काम करायला मिळतं, सगळ्या गोष्टी व्यवस्थित होतात, जागच्या जागी ट्रॅव्हलिंगची गरज नाही आहे. हे सगळं जरी झालं असेल तरी लॉकडाऊन जेव्हा एक्सटेंड झाला, इट्स ऑलमोस्ट 1.5 इयर झालेले आता. बिकॉज ऑफ दॅट पेन, बाकीच्या गोष्टी, सेडेंटरी लाईफस्टाईल, लॅक ऑफ न्यूट्रिशन आणि मेनली जिम, मॉर्निंग वॉक, स्विमिंग पूल या सगळ्या गोष्टी बंद असल्यामुळे बॅकचे, नीचे प्रॉब्लेम्स बऱ्यापैकी वाढलेले आहेत. रुटीनली सगळेजण कॉम्प्युटर, लॅपटॉप, मोबाईल आणि त्यांचं ऑफलाईन ऑफिस वर्क हे मोबाईलवरनं आणि लॅपटॉपवरनं सुरू असायचं. त्यामध्ये आपले जे सिनियर सिटीजन किंवा एल्डरली सगळे लोक असतात घरामधले, त्यांच्यासाठी ही गोष्ट, त्यांचा मॉर्निंग वॉक बंद झालाय, त्यांचं जिम बंद झालंय, इव्हन त्यांचं चालणं फिरणं विच इज हेल्दी फॉर देअर बॅक अँड लेग, आर्थरायटिस आहे पेशंटला, त्यांच्यासाठी चालणं, बाकीच्या गोष्टी या सगळ्या आता बंद झालेल्या. लकीली आता थोड्याशा प्रमाणात ओपन झाल्यामुळे एक्सरसाइज वगैरे या गोष्टीला सुरुवात झालेली आहे. सो वी विल जस्ट लुक द व्हॉट आर द स्पाइन प्रॉब्लेम्स इन अन एल्डरली पेशंट. सो इव्हॅल्युएशन वाईज बघता की आधी उत्पत्तीपासून क्वाड्रुपॅड ज्याला म्हणतो आपण, त्याच्या म्हणजे आपला स्पायनल कॉर्ड हा जमिनीशी हॉरिझॉन्टल होता. इव्हॅल्युएशन मध्ये आपण तो व्हर्टिकली हळूहळू होत होता. नंतर लो बॅक पेन, बाकीच्या गोष्टी, बॅड पोश्चर, सेडेंटरी लाईफस्टाईल याच्यामुळे परत माणूस त्याच दिशेने वाकत चाललेला आहे. याला अर्ली डिजनरेशन और किंवा ऑस्टिओपोरोसिस या गोष्टी आपल्याला परत झुकवण्याच्या मार्गाकडे नेत आहेत. सो लाईफ एक्सपेक्टन्सी बद्दल जर बोललो, सो सी अबाउट 2020 द मीन लाईफ एक्सपेक्टन्सी इन इंडिया इज रफली अराउंड 65-70 पर्यंत आहे. 2045-50 मध्ये जर बघितलं, फॉरगेट अबाउट दिस कोविड थिंग विच हॅव टेकन अवे अवर बिलव्ड एव्हरीथिंग, बट याच्यामध्ये सुद्धा साधारण 70-75 म्हणजे एल्डरली पॉप्युलेशनचं प्रमाण हे साधारण 2050 पर्यंत जास्त राहण्याची शक्यता आहे. बॅक पेन, बाकीच्या गोष्टी जर इफ वी सी केअरफुली, द ओव्हरऑल पर्सेंटेज ऑफ अ स्पाइन प्रॉब्लेम इज ऑलमोस्ट, you can see is more, there is a female predominance over a male predominance ratio जो आहे त्याच्यामध्ये फिमेल्स मध्ये बिकॉज ऑफ एज रिलेटेड ऑस्टिओपोरोसिस या गोष्टी बऱ्यापैकी जास्त दिसतात. सो कॉजेस ऑफ बॅक पेन इन द एल्डरली पेशंट इट इज क्लासिफाईड लाईक डिस्कोजेनिक म्हणजे डिस्क पासून येणारी पेन, ऑस्टिओपोरोसिस हाडाची मृदुता याच्यामुळे येणारी पेन, फेल्ड बॅक सिंड्रोम, मेकॅनिकल स्पाइन जो कॉलम आहे आपला तो काही स्पेसिफिक बोन्स, त्याच्यानंतर जॉईंट, डिस्क आणि त्याला सराउंड केलेल्या सगळ्या मसल पासून बनलेला आहे. सो इफ देर इज अ डिस्टर्बन्स इन द मेकॅनिक्स, बॅक पेन स्टार्ट्स. बोन डिसीजेस असतात, काही कॅन्सर, मेटास्टासिस, काही इंजुरी लाईक फॉल, इन्फ्लेमेटरी, साधारण संधिवातापासून ते बाकीच्या गोष्टीपर्यंत हे इन्फ्लेमेटरी कॉजेस सुद्धा रुमॅटॉइड आर्थरायटिस सारखे आजार आहेत. हे सर्व इन्फ्लेमेटरी कॉजेस सिनियर सिटीजन किंवा एल्डरली पेशंटच्या बॅक पेनचं कारण ठरू शकतं. सो याच्यामध्ये इफ दर इज लंबर स्पाइन डिसऑर्डर इन द एल्डरली पेशंट, देर इज अ डिस्क डिजनरेशन, म्हणजे वयामानानुसार तुमच्या डिस्क मधलं जे लिक्विड आहे ते कमी व्हायला लागतं. आजकाल हे बऱ्याच यंग पेशंट्स मध्ये सुद्धा कमी दिसतं. याला कारण बरीचशी असतात, पण एकच आहे, लॅक ऑफ एक्सरसाइज असल्यामुळे तुमची जी डिस्क आहे ती ओव्हरलोड होते. ओव्हरलोड झाल्यामुळे त्याच्यातलं जे पाण्याचं प्रमाण आहे किंवा एक जेल असते त्याच्यामध्ये, ज्याला न्यूक्लियस म्हणतात, ते साधारणतः मर्ज होऊन त्याच्यातली जी शॉक ऍब्झॉर्बिंग कॅपॅसिटी असते ती बऱ्यापैकी कमी होते. सो डिजनरेशन, यालाच अर्ली डिजनरेशन किंवा चकतीचं वय होणं ही गोष्ट म्हणली जाते. ऑस्टिओपोरोटिक स्पाइन फ्रॅक्चर जे असतात ते एल्डरली पेशंट्स मध्ये जास्त दिसतात. सो त्याच्यासाठी डिजनरेशन म्हणजे मणक्याचं वय होणे आणि मृदुता कमी, घनता कमी होणे, अस्थिमृदुता ज्याला म्हणतात. त्याच्यामुळे लो बॅक पेन, कायफोटिक स्कोलियोस्टिक डिफॉर्मिटी म्हणजे की मणका हा पुढे वाकला जातो किंवा साईडला बेंड होतो. या गोष्टींनी न्यूरोलॉजिकल सिम्पटम्स पायामध्ये जाणवायला लागतात, जसे की पायातली ताकद कमी होणे. सो प्रिव्हलन्स या गोष्टीचा साधारणतः 51 to 60 एज पर्यंत साधारणतः बॅक पेनचं प्रमाण 32% आहे पुरुषांमध्ये, ते 52.7% हे फिमेल्स मध्ये आहे. अबव्ह 61 इज 19% आहे मेल्स मध्ये आणि 12.2% फिमेल्स मध्ये आहे. So back pain, what is the back pain? There are many more joints in the back than the disc. There are many more muscles than the joints. Most common cause of the low back pain is one or more muscle forget to relax, which is called as a somatic dysfunction. आपण बघतो नेहमी बॅक पेन झाली की मसल मध्ये स्पॅझम होतो. कधी कधी बॅक पेन हे लेग पेन बरोबर सुद्धा सोबत जोडलं गेलेलं असतं. इथे बघितलं तर हे मसलच्या स्पॅझम मध्ये गेल्या की जिथनं पायाची नस बाहेर पडते तिथली ती नस दाबली जाते, ती नस त्या होल मधनं बाहेर पडते, ते दाबलेलं जातं, तिथे सूज येते आणि तुम्हाला त्याच्यामुळे बॅक पेन बरोबर लेग पेन पण व्हायची शक्यता जास्त असते. मोस्ट ऑफ द डिस्क हर्निएशन ऑकर्स ॲट L5S1 म्हणजे शेवटच्या ज्या माकड हालला जोडलेली चकती असते, कारण तो सगळ्यात लास्ट हालचाल मोबाईल सेगमेंट ज्याला म्हणतो तो L5S1 असतो. सो सगळ्याच बॅक पेनचं कारण हे थोरॅसिक, लंबर, स्पाइन असो, सॅक्रोइलेग जॉइंट जिथे माकड हाडाला म्हणून स्पायनल हे जोडलेला असतो त्याच्यामुळे. तर हे क्रिएट या सगळ्या गोष्टीचं रिफ्लेक्शन सुद्धा बॅक पेन मध्ये होऊ शकतं. सो आता आपण थोडं ब्रीफ मध्ये बघू की एल्डरली पेशंट मध्ये बॅक पेनचे काय कारण असतात. मेकॅनिकल असतं, डिस्क डिजनरेशन असतं, फॅसेट सुजल्यामुळे किंवा हायपरट्रॉफी, ओव्हरलोड झाल्यामुळे त्याचा आकार वाढतो, त्याला फॅसेटल हायपरट्रॉफी म्हणतात. लंबर कॅनल स्टिनोसिस, बॉडी हे आपलं प्रोटेक्शन मेकॅनिझम सोडत नाही. जेव्हा तुम्हाला बॅक पेन होतं आणि ते रिपीटेड इन्स्टॅबिलिटी त्याच्यामध्ये हालचाल होत राहते, तर काही प्रोटेक्टिव्ह लिगामेंट्स हे अजून थोडेसे जाड होतात, पण त्यांना त्यावेळेस हे नसतं समजत की आपल्या जे जाडी वाढल्यामुळे स्पायनल कॉर्ड पण हळूहळू दाबला चाललेला आहे. सो इन्फ्लेमेटरी इन द सेन्स काही सूज आहे का त्याच्यामध्ये, रुमॅटॉइड आर्थरायटिस, अँकलोजिंग स्पॉन्डिलायटिस यासारखे आजार आहेत. इन्फेक्शन, इंडियामध्ये ट्युबरक्युलोसिस सारखं मोस्ट कॉमन कॉज आहे की एल्डरली पेशंट्स मध्ये ते बॅक पेन क्रिएट करू शकतं. निओप्लास्टिक, काही ट्युमर्स असतात, त्यांचं सीडिंग होऊन काही मेटास्टॅसिस झालेलं आहे, त्या गोष्टीमुळे सुद्धा बॅक पेन होतं. मेटाबॉलिक इज ऑस्टिओपोरोसिस, विटामिन डी डेफिशियन्सी, सायकोलॉजिकल, सिस्टमिक इलनेस काही असेल त्याच्यामुळे सुद्धा बॅक पेन होऊ शकतं. तर आता हे इव्हॅल्युएशन कसं करायचं. सगळ्याच बॅक पेन ह्या एकाच तराजूमध्ये मोजून होत नसतात. सो डिफरंट टाइप ऑफ बॅक पेन दे हॅव बी इव्हॅल्युएटेड ऑन द सेपरेट बेसिस. साधारणतः एल्डरली मध्ये पुअर मोटर कंट्रोल, व्हिज्युअल हिअरिंग लॉस, त्याच्यामुळे फॉल पडायचं प्रमाणही जास्त वाढतं. त्या हिस्ट्रीनुसार जर पेशंट जर पाय घसरून वगैरे पडला असेल तर त्याचे इन्व्हेस्टिगेशन बाकीच्या गोष्टी त्याप्रमाणे केले जातात. याच्याबरोबर साधारणतः एल्डरली पेशंट्स मध्ये हायपरटेन्शन, डायबिटीज, हार्ट डिसीज, रिनल डिसीजेस, CNS प्रॉब्लेम जे आहेत, कधी कधी एज रिलेटेड डायबिटीसमुळे लॉंग स्टँडिंग प्रेशर असेल तर त्या प्रेशर सोबत डायबिटीस हा त्यांच्या नसांमध्ये पण गेलेला असतो, त्याला डायबेटिक न्यूरोपॅथी पण म्हणतात. या गोष्टींचा संबंध डायरेक्ट प्रेशरशी न लावता आतनं नसेला काही त्रास आहे का डायबिटीसमुळे हे सुद्धा बघितलं जातं. काही रिस्ट्रिक्टेड ॲम्ब्युलेशनचे पेशंट असतात, बेडरिडन पेशंट असतात, त्याच्यामध्ये आपल्याला पायाच्या रक्तवाहिन्या सुद्धा बघायला लागतात की त्याच्यात कुठे क्लॉट झालेले आहेत का, कॅन्सरची हिस्ट्री विचारायला लागते, फीवर, अनएक्सप्लेन्ड वेट लॉस, या सगळ्या गोष्टी आपल्याला पाहायला लागतात. बिकॉज याच्यामधनं कुठं कॅन्सरजन्य गोष्टी आहेत आणि त्याच्यामुळे ते बॅक पेन सुरू आहे का ते बघणं गरजेचं असतं. क्रॉनिक इन्फेक्शन्स आहेत, ड्युरेशन अँड क्वालिटी ऑफ पेन हे सुद्धा बघायला लागतं. आणि त्यात आतापर्यंतची काय ट्रीटमेंट झाली, मीन्स रिस्पॉन्स टू द प्रिव्हियस ट्रीटमेंट. मेनी पेशंट व्हॉट दे डू, they just take medicine and wait for the pain to reduce and then they will start the exercise. But thing is like a piece of a pyramid. When you start exercise, you have to take medicine, you have to take physiotherapy, you have to follow do's and don'ts, and you have to continue exercise. याच्यातला एक जरी पार्ट मागे राहिला तर म्हणावा तसा रिझल्ट मिळत नाही. याच्यामध्ये रेड फ्लॅग्स काय काय असतात की फीवर आहे, अनएक्सप्लेन्ड वेट लॉस, या गोष्टीकडे एल्डरली लोकांमध्ये जास्त लक्ष देणं गरजेचं असतं रादर दॅन यंगर पॉप्युलेशन. ब्लॅडर वॉवर इनकॉन्टिनन्स, यामध्ये साधारणतः तो नसेच्या दबावामुळे आहे का प्रोस्टेट सारख्या ग्रंथीचा जो पुरुषांमध्ये विकार होतो त्याच्या संदर्भात आहे, हेही सुद्धा तज्ञ डॉक्टरांकडनं बघणं गरजेचं असतं. वर्सनिंग न्यूरोलॉजी म्हणजे मला चालताना किती त्रास होतोय, टॉयलेट पर्यंत जाता येते का नाही, बेड रिडन पेशंट्स असतील त्या पेशंटसाठी बाकीची सुद्धा केअर घेणं गरजेचं आहे. अर्ली डायग्नोसिस, की चालताना न्यूरोलॉजिकली प्रॉब्लेम काय आहेत, ब्लॅडर, युरिन स्टूल पास व्हायचं प्रमाण जर होत नसेल, त्याला लवकर इन्व्हेस्टिगेशनची गरज असते. याच्यामध्ये साधारणतः पेशंट, इव्हन द पेशंट इज देअर इन द ओपीडी, वी जस्ट चेक हिज बॅक पोस्चर, गेट, हाऊ ही वॉक्स, द रेंज ऑफ मोशन. Whenever there is a spasm, there is restricted mobility or the motion of the back, and even there is a leg pain because of swelling of the nerve, the range of motion get halted at a certain point. Palpation of the spine, याच्यामध्ये आपण पूर्ण मणक्यावरून हात फिरून बघतो की तो मणका कुठे फिरलेला आहे का, त्याच्यात काही बाक आलेला आहे का, किंवा तो कुठे त्याच्यामध्ये पेनफुल स्पॉट कुठे आहे. बरेचदा एल्डरली पेशंटमध्ये पडल्यानंतर समजा फ्रॅक्चर असेल मणक्यामध्ये, तर तिथे लोकलाइज पेन झालेलं असतं, ते हळूहळू कमी होत खाली लो बॅक पर्यंत येतं. पण मग हा इश्यू सेमच आहे का त्याच्यावर दुसरी ट्रीटमेंट करणं गरजेचं आहे, या गोष्टी इन्व्हेस्टिगेशन नंतरच करतात. न्यूरोलॉजिकल टेस्टिंग असतात की त्याचा एक स्पेसिफिक पॅटर्न असतो. आपल्या इथे कुठल्याही बॅक पेन विथ लेग पेनला सियाटिका हे नाव देणं गरजेचं आहे, कारण तो प्रचलित शब्द आहे पूर्ण. सियाटिकाचे सुद्धा प्रकार असतात की पायाच्या साईडनी दुखतंय, मांडीच्या मागच्या बाजूने दुखतंय, समोर दुखतं. त्याच्यानुसार ते क्लिनिकल डायग्नोसिस आणि एमआरआयशी कोरिलेशन करून त्या गोष्टी बघितल्या जातात की नक्की हा त्रास कसा आहे. विथ द इव्हेंट ऑफ अन एमआरआय आणि प्रिसाइज डायग्नोसिस, आपण ज्याला टार्गेट शॉट म्हणतो, की आधीच्या काळामध्ये लंबर कॅनल स्टेनोसिस किंवा असेल तर पहिल्यापासून पूर्ण मणका उघडून बघितलं जातं. आता आपण टार्गेटेड सर्जरी करतोय. फक्त लंबरचा प्रॉब्लेम आहे तेवढाच आणि एकाच चकतीचा असेल तो पण करण्यात येतो. बरेचदा फक्त एमआरआय करून एमआरआय नॉर्मल आहे म्हणून मला बॅक पेन तरी का होतं या गोष्टीवर विचार करून जास्त उपयोग नसतो, कारण त्याचे जे पेरिफेरल कॉजेस असतात दॅट वी हॅव टू ऑल्सो टेक इन कन्सिडरेशन, लाईक ऑस्टिओपोरोसिस आहे का, मसल इम्बॅलन्स आहे का, या सगळ्या गोष्टी बघायला जातात. अ केअरफुल हिस्ट्री टेकिंग अँड अ फिजिकल फाइंडिंग दे आर व्हेरी इम्पॉर्टंट. डिफरन्शियल डायग्नोसिस, मला फक्त बॅक पेन डिस्क झिजल्यामुळेच आहे आणि मी ते इग्नोर करतोय असं नाही. द मेकॅनिकल कॉजेस ऑफ लेग pain and back pain, they are almost 97%. The non-mechanical is about 1%, and the visceral diseases, म्हणजे कुठनं ट्रान्सफर झालेलं पेन आहे, that is about 2%. या 97% is a large chunk. So almost त्याच्यातला herniated disc is 4%, stenosis 3%, असं करत करतो 97. आणि लंबर स्पाइन स्प्रेन, बॉडीमध्ये आपल्या लंबर स्प्रेन म्हणजे चकतीचा आवरणाला थोडासा तडा जाणे, ज्याला आम्ही अॅन्युलर टायर म्हणतो, तो हा कॉमनेस्ट भाग आहे आणि ती प्रोसेस आपल्या शरीरामध्ये होत असते. ते टेअर हीलही होतात. पण आपण जर या गोष्टी व्यवस्थित डॉक्टरांचं मार्गदर्शन न घेता एक्सरसाइज नाही सुरू केल्या, डूज अँड डोंट्स केलं, वेट उचलले, तर तो टेअर वाढत जातो. आणि तुम्ही स्लिप डिस्कचं ऐकलेलं असेल तर हे त्याचा आधीचा त्रास आहे तो, ज्याला अॅन्युलर टेअर म्हणतो, त्या टेअरमधूनच डिस्क बाहेर येते. सो अॅन्युलर टेअरला जर तुम्ही व्यवस्थित काळजीपूर्वक हँडल केलं, तज्ञांचा सल्ला घेतला, तर आपल्याला ही गोष्ट पुढे टाळता येते. तर तपासण्या काय करायच्या, जनरलाइज साधारणतः यंगर पेशंट आणि एल्डरली पेशंट मध्ये थोडा फरक असतो की त्यांच्या लिव्हर फंक्शन, हिमोग्राम, या ब्लड टेस्ट करायला लागतात, कारण त्यांना बऱ्याचशा कोमॉर्बिडीज असतात. इन्फ्लेमेटरी मार्कर्स लाईक SRCRP, या साधारणतः सुजेमध्ये या गोष्टी वाढलेल्या असतात, ते सुद्धा तुमचे डॉक्टर करून घेतात. युरिन रुटीन इन्फेक्शन आहे का ते रूल आउट करण्यासाठी. प्रोस्टेट स्पेसिफिक अँटीजन PSA और ट्युमर मार्कर्स, हे एल्डरली पेशंटचे काही ट्युमर्स ज्याच्यासाठी आपण कानाडोळा करून नाही चालत, त्याच्यामुळे ट्युमर मार्कर सुद्धा करणं गरजेचं आहे, जेव्हा क्लिनिकल सस्पिशन डॉक्टरला तुमच्या आहे की तुम्ही काहीतरी कॅन्सरची शक्यता असू शकते. इमेजिंग मध्ये आपल्याला नॉर्मल रुटीन एक्सरे माहितीच असतो. त्याच्यात गोष्टी पहिल्यांदा एक्सरे मध्ये हाडाची क्वालिटी कशी आहे, त्याला कुठं बाक आहे का. एल्डरली पॉप्युलेशन मध्ये साधारणतः मणका हा थोडासा वाकडा होणे किंवा फिरणे ही गोष्ट डिजनरेशनमुळे होऊ शकते. कारण ऍक्शियल लोडिंग ज्याला म्हणतात, की तुमच्या मणक्यावर पूर्ण भार आहे आणि त्या एका बाजूची चकती झिजली गेली आहे, तर ते एका बाजूचा फॅसेट समजा जास्त ओव्हरलोड झालं, तर तो मणका त्याच्या अपोजिट साईडला स्लिप व्हायला लागतो. हे असं करत प्रत्येक 2-3 मणक्यांचं झालं, याला डिजनरेटिव्ह स्कोलियोसिस म्हणतात. या गोष्टी करेक्टेबल असतात. डेक्सा स्कॅन नावाची टेस्ट जी आहे तुमच्या हाडाची घनता बघण्यासाठी वापरली जाते. हे आताचा रिसेंट साधारणतः इन्व्हेस्टिगेशन आहे. इट्स अ क्वांटिटेटिव्ह अनालिसिस ऑफ युअर ऑस्टिओपोरोसिस. आधी कॅल्शियम देऊन फक्त भागतं का, तर नाही. पहिल्यांदाच आपल्या इथे साधारणतः मेनोपॉज नंतर फिमेल्सला ऍडवाइस केलं जातं की तुम्ही कॅल्शियम वगैरेच्या गोळ्या घ्या. पण थोडा रिलक्टन्स असतो, काही मेडिकल प्रॉब्लेम असतात की कॅल्शियम सूट होत नाही, कॉन्स्टिपेशन होतं, ब्लॅडर स्टोन्सचा त्रास असतो, त्याच्यामुळे त्या गोष्टी घेतल्या जात नाही. वयामानाप्रमाणे ह्या ऑस्टिओपोरोसिस वाढत जातं. सिटी स्कॅन, MRI या गोष्टी आपल्याला साधारणतः कॅन्सर, हर्निएटेड डिस्क आणि बाकीच्या याच्यामध्ये डायग्नोसिस टू द पॉइंट पोहोचण्यासाठी केलं जातं. आता याची मॅनेजमेंट कशी असते? साधारण स्टार्टिंग फ्रॉम मेडिसिन, फिजिकल थेरपी, फिजिओथेरपी, पेन मॅनेजमेंट, कायरोप्रॅक्टिक क्लिनिक, न्यूरोलॉजिकल इव्हॅल्युएशन आणि स्पाइन सर्जरी या साधारण या एवढ्या ग्रॉस हेड खाली असतं. मी स्टेजिंग देताना साधारणतः पहिला टप्पा फिजिओथेरपी, गोळ्या औषधं वगैरे या सगळ्या दिल्या तर साधारणतः 80% लोक तेवढ्यावरच बरे व्हायची शक्यता असते. पण हा एल्डरली लोकांचा हा प्रॉब्लेम थोडासा ऑस्टिओपोरोसिस रिलेटेड असतो. त्याच्यानंतर जॉईंट्सवर सूज आलेली असते, नसा जास्त दबलेल्या असतात, मणका स्पाइन पूर्ण स्टिनोसिस मध्ये असतो, पूर्ण स्टेनोसिस, त्यांचे सिम्पटम्स थोडेसे चालण्यात डिफिकल्टी होणे, गुडघेदुखी, या सगळ्या गोष्टी आता कोविडमुळे आपण थोडासा त्याच्याकडे कानाडोळा झालेला आहे. तरी आता लॉकडाऊन ओपन झालंय, सगळ्या गोष्टी सुरळीत होत आहेत आणि म्हणून आता पेशंट सुद्धा न भीती बाळगता डॉक्टरकडे येत आहेत, प्रॉब्लेम सांगतायत. इतके दिवस बऱ्याचदा हे दुखणं अंगावर काढलेलं गेलेलं असतं, व्यवस्थित व्यायाम होत नाहीये म्हणून किंवा फिजिओथेरपिस्टची भेट होत नाही, डॉक्टर्स भेटत नाहीयेत, कारण पेशंटच्या मनात भीती असते की तिथे गेल्यावर नवीन काही अजून कोरोनाचं इन्फेक्शन व्हायला नको. थिंग्स आर ओपन आउट. आपण परत एकदा फोकस बॅक करतो या स्पाइनच्या हेल्थवर. साधारणतः या लंबर स्पाइनच्या कंडिशन्स मध्ये एक हर्निएटेड डिस्क एक असते, त्याच्यानंतर लिस्थेसिस, इन्स्टॅबिलिटी एक असते. आता कॉमन टर्म वापरला जातं स्पॉन्डिलोलायसिस, म्हणजे काय की डिजनरेशन ऑफ द स्पाइन, यातला स्पॉन्डिलोलायसिस म्हणतात. थोड्याशा कन्फ्युजिंग टर्म असतात. व्हॉट इज स्पॉन्डिलोलायसिस? द जनरल मीनिंग जनरली इट मीन चेंजेस इन द वर्टिब्रल जॉइंट्स characterized by an increasing degeneration on the intervertebral disc. म्हणजे डिस्क थोडीशी डिहायड्रेट होते, त्याच्यातलं न्यूक्लियस कंटेंट कमी होतं, फॅसेट म्हणजे जॉईंट्सवर लोड कमी होतं, लिगामेंट थोडे फुगायला लागतात. या सगळ्या गोष्टी जर बघितल्या आपण, याच्यामध्ये जे बाहेर पडणाऱ्या नसा पायाला सप्लाय करणाऱ्या असतात, त्या गोष्टीला सुद्धा प्रेशर वाढत जातं. नंतर स्पॉन्डिलोलायसिस म्हणजे की हाडाचा जो बंध असतो दोन जॉईंटला जोडणारा, त्याच्यामध्ये ब्रेक असतो. आणि लिस्थेसिस म्हणजे मणका पुढे सरकल्यासारखी गोष्ट ज्याला म्हणतात, त्याला स्पॉन्डिलोलायसिस. आज थोडंसं मायक्रोस्कोपिक सर्जरी या गोष्टीचं थोडंसं फंडा नवीन आलेला आहे, त्याच्यामुळे प्रत्येक केस त्या मायक्रोस्कोपी मध्येच बसत नसते. प्रत्येक पेशंट, प्रत्येक कंडिशन ही वेगळी असते. कधी पेशंटचा एक पाय दुखतोय, कधी दोन्ही दुखतात, आणि जर चालल्यानंतर थोडं अंतर कमी होत असेल तर त्याला क्लॉडिकेशन म्हणतात. हर्निएटेड डिस्क म्हणजे मी तुम्हाला सांगितल्याप्रमाणे डिस्कचा थोडासा पार्ट बाहेर येऊन तो नसेला दाबतो, याला हर्निएटेड डिस्क म्हणतात. यासाठी सुद्धा आपण फिजिओथेरपी, एक्सरसाइज, डूज अँड डोंट्स, मेडिकेशन या सगळ्या गोष्टी पूर्ण करून बघतो आपण. या पेशंटला साधारण 3 आठवडे, महिना, 1.5 महिन्याचा कालावधी दिला जातो. पण जर बॅक पेन कमी झालं आणि लेग पेन पण कमी झालं तर दे आर व्हेरी हॅपी पेशंट, की एक्सरसाइज वगैरे त्यांना कंटिन्यू सांगितल्या जातात. पण यामध्ये जर सगळं करून जर फरक नाही पडला तर आपल्याला काही ट्रीटमेंट ऑप्शन्स चूज करायला लागतात. लाईक कॉन्झर्वेटिव्ह म्हणजे औषध गोळ्या नेणारं, थोडीशी बेड रेस्ट लागते, स्पायनल मॅनिप्युलेशन थेरपिस्ट कडनं करून घ्यायला लागतं, फिजिकल थेरपी लागते आणि फॉर टाइम बिंग मेडिकेशन दिलं जातं. सर्जिकल ट्रीटमेंटमध्ये सिलेक्टिव्ह नर्व रूट ब्लॉक, ज्या पेशंटला जास्त प्रेशर नाहीये पण सिम्पटम्स आहेत, सर्जरीची आता गरज नाहीये, पण आपल्याला काही इंजेक्शन जे डायरेक्ट तिथे नसेच्या जवळ औषध सोडून पेन कमी करायसाठी हा एक मिडपाथ रेजिम आहे, तो सुद्धा आपण एल्डरली पेशंटमध्ये ट्राय करू शकतो. बरेचसे पेशंट मेडिकली फिट नसतात पण पेन गेलं पाहिजे, त्या लोकांसाठी सुद्धा आपण हे इंजेक्शन देऊ शकतो. मायक्रोडिस्केक्टॉमी काय असते, याचं लेस अ स्मॉल हाफ इंच इन्सिजन असतं, जेवढा टार्गेटेड प्रॉब्लेम आहे तेवढाच सॉल्व्ह केला जातो. या 60 वर्षाचे साधारण 59 वर्षाचे ग्रस्त आहेत, एक छोटा डिस्कचा तुकडा बाहेर आला होता, दुर्बिणीच्या द्वारे तो साधारणतः एक 5 सेंटीमीटर साधारणतः एवढ्या इन्सिजन मधनं मोठी डिस्कही आपण व्यवस्थितरित्या काढू शकतो. पेशंट happily went home, no pain after that, but he still continued with the exercises to prevent the further degeneration. What is the spinal canal stenosis? This is a characteristic of an elderly patient. The standing provokes the symptoms. उभं राहिल्यावर जास्त त्रास होतो, लेग पेन मध्ये, बॅक पेनचा, पेन अँड द वीकनेस इन द लेग्स. पेशंट लीन फॉरवर्ड, नर्वला थोडंसं ब्रीदर मिळतं, जिथून नस बाहेर पडते त्याच्यामध्ये थोडीशी जागा जास्त झाल्यानंतर लेग पेन कमी होतं. सो यांचं फॉरवर्ड बेंडिंग पोस्चर असतं आणि त्याच्यामध्ये ते चालणं प्रेफर करतात. सिटिंग बेंडिंग फॉरवर्ड बेंडिंग रिलीव्स द सिम्पटम्स. Generally, if you see there is a grading of a disc in elderly patient. This is the grade 1 is normal and grade 5 बघितलं तर ती कम्प्लीट डिहायड्रेट होऊन त्याच्यामधलं सगळं कंटेंट अगदी गेलेलं असतं, बोन टू बोन कॉन्टॅक्ट झालेला असतो किंवा याच्याबरोबर मणके हलायला सुद्धा सुरुवात झालेलं असतं. याच्यामध्ये मी जसं सांगितलं एमआरआय पिक्चर मध्ये फक्त चकतीच वाढत नाही तर हे जॉईंट सगळे वाढायला लागतात, त्याचं प्रोटेक्टिव्ह लिगामेंट ज्याला आम्ही फ्लावा म्हणतो तेही वाढायला लागतं. सो यामुळे मज्जारज्जूचा मधला भाग आणि बाहेर पडणाऱ्या नसा या दोन्हीलाही ताण बसतो. युजली या एज मध्ये पेशंट असे थोडेसे वाकून चालतात, त्यांना काहीतरी सपोर्ट लागतो, थोडं चाललं की पाय भरून येतात. युजली पेशंटचे सिम्पटम्सच ते असतात की मला थोडं चालल्यानंतर त्रास वाढायला लागतो. रेडिएशन टू द बटक्स म्हणजे कमरेपासून खोब्यापर्यंत दुखणं जातं, थाईज मध्ये जातं, लोअर लेग मध्ये जातं. पेन आपण मागच्या बाजूला जसं भुजंगासन किंवा या गोष्टी केल्या तर ते वाढतं, कारण तिथे फोरामेनची साईज कमी होते. यासाठी सुद्धा वी ट्राय फर्स्ट कॉन्झर्वेटिव्ह ट्रीटमेंट लाईक मॉडरेट बेड रेस्ट, स्पायनल मॅनिप्युलेशन, फिजिकल थेरपी, मेडिकेशन. या पेशंटला सुद्धा सिलेक्टिव्ह नर्व रूट ब्लॉक म्हणजे इंजेक्शन देऊन बघता येतं, पण रिलीफ हा त्यांच्या स्टेनोसिसवर अवलंबून असतो. डिकम्प्रेसिव्ह लॅमिनेक्टॉमी याच्यामध्ये थोडंसं ओपन सर्जरीज प्रकारात असतं. हे दुर्बिणीतनं करण्यापेक्षा जर मल्टी लेवल प्रॉब्लेम असेल तर ओपन सर्जरी, स्मॉल ओपन, मिनी ओपन या गोष्टी पेशंटला खूप बेनिफिशियल असतात. तसं या पेशंटमध्ये देयर इज नंबर ऑफ लेवल स्टेनोसिस आहे, म्हणजे शेवटचे 3 ते 4 मणक्यांमध्ये दाब आहे. भविष्यामध्ये मी जर समजा एकाच लेवलचं केलं तर त्यांचा त्रास पूर्णपणे जाणार नाहीये, कारण या पेशंटचे पाय पूर्ण भरून येतात, चालायला त्रास होतो. याच्यामध्ये आम्ही ओपन लॅमिनेक्टॉमीचा सल्ला दिलेला असतो. स्पायनल इन्स्टॅबिलिटी बिकॉज ऑफ डिस्क डिजनरेशन अँड द हायपरमोबाईल जॉइंट loses normal stability, it causes or adds up in the back pain or leg pain more. Like this lady, हिचे साधारणतः 3 ते 4 मणके थोडेफार पुढे प्रमाणात मागे झालेले असतात. हे एल्डरली पेशंट मध्ये बॅक मसलच्या विकनेसमुळे युजली इट्स लाईक अ बॅरल, कमरेचे काही स्नायू असतात, पोटाचे स्नायू आणि आपले लॅटरल ज्या पोटाचे स्नायू असतात त्याच्यामध्ये सुद्धा एक बॅरल कंपार्टमेंट सारखं असतं. या मसल सगळ्या स्ट्रॉंग राहिला तर मणक्याची स्टॅबिलिटी व्यवस्थित टिकून राहते. साधारण मी टेंटचं उदाहरण देतो, त्याला सेंट्रल रॉड असतो आणि ते रोपनी बांधलेलं असतं. इवन दो वी कट 1 or 2 रोप, टेंट हलणार आहे, त्या प्रकारे त्या गोष्टी होतात. हे स्पायनल कॅनल स्टेनोसिस विथ लिस्थेसिस. पेशंटला त्रास जास्त होता, घरात चालता येत नव्हतं, म्हणून पोस्ट कोविड पेशंटची तयारी होती, सर्जरी व्यवस्थित केली, कोरोनाचे बाकीचे काही सिम्पटम्स नाहीत. आता बरेचसे पेशंट कोरोनातनं बरे होऊन परत या गोष्टीकडे येत आहेत. स्पाइन सर्जरी, आर्थरायटिस, सगळे दुखणे, फिजिओथेरपी या गोष्टी रुटीनली परत चालू झालेल्या आहेत. डिफॉर्मिटी म्हणजे काय की मणका देयर इज अ चेंज इन द ऍक्च्युअल रोटेशन, जे मी तुम्हाला एक्सप्लेन केलं आधी की त्याच्यामुळे मणका एका बाजूला कुठेतरी मणक्यांची जी माळ असते 2 ते 3 लेवलमध्ये ते फिरायला लागते. सो या पेशंट्स मध्ये सुद्धा आपल्याला सर्जरी करून हा भाग काढणे गरजेचं असतं, कारण ज्या बाजूला ते स्कोलिओसिस झालेलं असतं तो स्पायनल स्टेनोसिस अजून वाढवतो, त्या बाजूच्या नसा अजून दाबलेल्या जातात, चालताना त्रास होतो, पेन कमी होत नाही कारण देयर इज एक्स्ट्रा बोन फॉर्मेशन. आपल्याला या गोष्टी सर्जिकली सगळ्या करेक्ट करता येतात. या पेशंट साधा 64 year old lady, degenerative scoliosis, multi-level stenosis. So we did almost 5-6 pair of screws fixed, spine made straight. Patient is very happy after COVID. Conservative, what are the conservative indication? If there is only back pain, conserve. There is no leg pain or claudication, conserve. Give a complete trial of physiotherapy, exercise, motivate them, take care of vitamin D deficiencies, calcium supplementation, everything. What is the problem selection? Patient age and comorbidities. If age is higher with other comorbidities, like the patient having heart disease and patient having cardiac function little less than normal, like other with the diabetes, diabetic neuropathy, liver problem, kidney problem, these are little high risk patient. Some previous surgeries, previous decompression surgeries, disc herniation, disc collapse, there is a listhesis. So we have to choose the appropriate patient for the appropriate treatment modalities. Surgical, when we opt for a surgery, if there is a failed conservative, सगळं करून पाहिले, व्यायाम केले, सगळे झाले, आयुर्वेदिक, होमिओपॅथी सगळं झाले, पण रिलीफ नाहीये, पर्सिस्टंट पेन आहे डिस्पाइट ऑफ कॉन्झर्वेटिव्ह ट्रीटमेंट, प्रोग्रेसिव्ह डिफॉर्मिटी, बाक वाढत चाललाय, सिग्निफिकंट डेफिसिट झालाय, पायाची ताकद कमी झालीये, पायात चप्पल सुटतेय, सगळ्या गोष्टी आहेत, पण या गोष्टी एल्डरली पेशंटच्या लक्षात येत नाही. घरचं कोणीतरी लक्षात आणून दिलं, या गोष्टी पडल्यानंतर लक्षात येतात की नाही माझ्या पायातली चप्पल सटकत होती. म्हणून हे न्यूरोलॉजिकल प्रॉब्लेम होण्याच्या आधी सर्जरी करून घेणं गरजेचं असतं. पॅथॉलॉजिकल लिजन्स असतात, मी सांगितलं म्हणून ऑस्टिओपोरोटिक आहेत, ट्रॉमॅटिक आहेत, काही कॅन्सर रिलेटेड गोष्टी असतात, त्या सुद्धा बघितलं जातं. थेरपी फॉर अ नॉन स्पेसिफिक बॅक पेन, म्हणजे ज्यांच्यामध्ये स्टेनोसिस बाकीच्या गोष्टी नाहीयेत, फक्त बॅक पेन आहे, लेग पेन नाहीये, फारसं चालायचं अंतर ओके, त्यांना इनिशियली पेन किलर देऊन बघितलं जातं, मॅनिप्युलेशन केलं जातं, रिटर्न टू अ नॉर्मल ऍक्टिव्हिटी. कारण या साधारणतः एल्डरली एज ग्रुपचे पेशंट, त्यांना डिपेंडन्सी नको असते कोणावर, स्वतःची कामं स्वतः करायची त्यांची प्रबळ इच्छाशक्ती असते. सो त्याच्यामुळे गोइंग टू द टॉयलेट, being independent, doing her or his own work, त्या गोष्टीसाठी we give a complete trial of a non-specific for the back pain in the elderly patient. ट्रॅक्शनच्या ट्रीटमेंट अवेलेबल आहेत, fascial joint इंजेक्शन असतात, काही ॲक्युपंक्चर सुद्धा सारख्या गोष्टी या सिम्पटमॅटिक बऱ्यापैकी रिलीफ देऊ शकतात. सो देर आर सम नेक प्रॉब्लेम्स इन एल्डरली. हे जे आता एल्डरली पर्सन हु आर वर्किंग ऑन द कॉम्प्युटर, त्यांच्यामध्ये नॉर्मली आधी स्टिनोसिस असतं मानेचं, त्या स्टिनोसिस मध्ये जर अजून त्याच्यामधला मणक्यात ताण वाढला किंवा हातापायात मुंग्या यायला लागल्या, तर हे मायलोपॅथी, ज्याला की सेंट्रल स्पायनल कॉर्ड जो असतो मानेचा, तो दबला जातो. त्याच्यामध्ये वॉकिंग डिफिकल्टी होतं, पेन इज लेस प्रॉमिनंट बट पुअर मोटर कंट्रोल, हातात ताकद कमी व्हायला लागते, हातातला पेन सुटायला लागतो, चालताना इम्बॅलन्स व्हायला लागतो. या गोष्टीकडे लक्ष देणं गरजेचं असतं. बाउल ब्लॅडर सिम्पटम्स साधारणतः 18 ते 15% लोकांमध्ये दिसून येतात. युजली कधी कधी त्याच्यामध्ये हातात दुखणं, पायात कळ, या गोष्टी सुद्धा येऊ शकतात. एल्डरली फिमेल्सचा हा थोडासा कन्सर्नचा टॉपिक आहे की ऑस्टिओपोरोटिक व्हर्टिब्रल फ्रॅक्चर्स, या युजली याच्यामध्ये प्रिडॉमिनन्स हा मेल्सच्या कंपॅरिझन मध्ये आफ्टर मेनोपॉज फिमेल्स मध्ये दिसायला लागतो. याच्यामध्ये जनरलाइज ऑस्टिओपोरोसिस म्हणजे काय, हाडाची घनता कमी होणे और लो बोन मास इन द मायक्रो आर्किटेक्चरल डिटोरिएशन ऑफ द बोन टिश्यू लिडिंग टू अ फ्रॅजिलिटी ऑफ द बोन. याच्याने काय होतं, त्याच्यातली घनता किंवा त्याच्यातलं मेशवर्क जर वीक झालं तर ते हाड मृदू होतं. मऊ हाडामध्ये फ्रॅक्चर व्हायची रिस्क बऱ्यापैकी जास्त असते. याचे सिम्पटम्स कसे असतात की पेन जास्त असतं, न्यूरोलॉजिकल डेफिसिट म्हणजे पडल्यानंतर पायातली ताकद कमी होणे, हातापायात दुखणे वाढणे, स्पायनल डिफॉर्मिटी, बाक येणे, गेट डिस्टर्बन्स, थोडीशी श्वास घ्यायला त्रास होणे, बाकीच्या गोष्टी जसं की हे साधारणतः आपण या गोष्टीकडे लक्ष नाही दिलं की हा बाक वाढत वाढत जातो. बऱ्याच प्रमाणात बाक वाढला की नंतर पायामध्ये सुद्धा त्रास व्हायची शक्यता जास्त वाढते. या गोष्टीकडे एल्डरली फिमेल्स मध्ये बाकीचं ज्याला आम्ही फ्रॅक्चर रिस्क इव्हॅल्युएशन जी गोष्ट म्हणतो, म्हणजे ट्रिव्हियल फॉल, छोटं बाथरूम मध्ये चालताना पडलं आणि मेजर फ्रॅक्चर झालं. कारण का तर ऑस्टिओपोरोसिस कडे व्यवस्थित लक्ष दिलं गेलेलं नाही. डिफिकल्टी इन फिटिंग पोज, कायफोसिस, या लेडी सारखं जर वाकून चालत असेल तर कायफोसिस झालेलं असतं, मणका वाकलेला असतो, हाईट लॉस होते, रिफ्लक्स इसोफेजायटिस, कारण आपण स्ट्रेट पोझिशन मध्ये राहत नाहीये, वेट लॉस व्हायला लागतो, फिअर फॉर फ्रॅक्चर ऑर फॉलिंग इन दिस कंडिशन, इम्पेड ऍक्टिव्हिटीज ऑफ डेली लिव्हिंग, बाथिंग, ड्रेसिंग, या गोष्टी सुद्धा सहसा जमत नाही. डिप्रेशन यायला लागतं या गोष्टींनी, स्लीप डिस्टर्बन्सेस होतात. साधारणतः ऑस्टिओपोरोटिक फ्रॅक्चर्स इन अ वुमन साधारण आपण जर कन्सिडर केलं तर व्हर्टिब्रल फ्रॅक्चर साधारण 7,50,000 व्हर्टिब्रल फ्रॅक्चर आहेत कम्पेअर्ड टू द हिप जे 2,50,000 आहेत. साधारणतः या बाकीच्या हार्ट अटॅक, स्ट्रोक, ब्रेस्ट कॅन्सर पेक्षा एल्डरली विमेन मध्ये फ्रॅक्चर होण्याचं प्रमाण खूप जास्त आहे. 26 मिलियन 2003 मध्ये साधारण 26 मिलियन हा प्रॉब्लेम एरिया होता, तो आता 36 मिलियन 2013 पर्यंत 10 वर्षामध्ये वाढलेला आहे. 1 out of 8 male and 1 out of 3 female, they are suffering from osteoporosis. There is a high incidence of among the men and the lower age group, the peak incidence compared to the Western countries. The peak incidence of osteoporosis Western countries मध्ये साधारण 70 to 80 years of age आहे, इंडियामध्ये 50 to 60 years. हे इंटरनॅशनल ऑस्टिओपोरोसिस फाउंडेशनचं रिसर्च वर्क आहे. प्रायमरी ऑस्टिओपोरोसिस काय असतो? इट्स अ टाइप 1, पोस्ट मेनोपॉझल, युजली 50 ते 70 वर्षात होतो. इस्ट्रोजन लॉस असतो. ट्रॅबेक्युलर मेशवर्क जे असतं आतमधलं हनीकॉम पॅटर्न सारखं, इट गेट्स अफेक्टेड. सेकंड टाइप काय असतं? एज रिलेटेड, मोर दॅन 70 इयर्स, इट्स एजिंग इज द मेन फॅक्टर. सेकंडरी ऑस्टिओपोरोसिस, याच्यामध्ये लाईफस्टाईल मॉडिफिकेशन काही फॅक्टर्स असतात, जसे लो कॅल्शियम इंटेक. युजली आफ्टर पोस्ट मेनोपॉझल वुमनला आपण साधारण कॅल्शियम सप्लिमेंटेशन घ्यावं असं रेकमेंड करतो. बऱ्याच ठिकाणी त्या गोष्टी होत नाहीत. इवन वी आर नॉट अवेअर ऑफ द विटॅमिन डी डेफिशियन्सी, एक्सेस विटॅमिन ए, कॅफिन इंटेक जास्त असतो, हाय सॉल्ट इंटेक, त्याच्यानंतर अल्कोहोल, या गोष्टीमुळे लाईफस्टाईल फॅक्टर्स सुद्धा ऑस्टिओपोरोसिस कडे आपल्याला घेऊन जातात. जेनेटिक काही गोष्टी, एंडोक्राइन, त्याच्यामध्ये सम पार्ट इज एंडोक्राइन, गॅस्ट्रोइंटेस्टिनल, लाईक की पुअर ऍब्सॉर्प्शन असेल, रुमॅटिक और द मिसलेनियस मेडिकेशन, आपण जर स्टिरॉइड्स खूप दिवस घेतलेले असतील या ना त्या कारणाने, जसे की आर्थरायटिसच्या पेशंटला लॉंग टर्म स्टिरॉइड असतात, त्याच्यामुळे कॅल्शियम ऍब्सॉर्प्शन डिले होतं और होतच नाही, त्याच्यामुळे ऑस्टिओपोरोसिस व्हायचं प्रमाण जास्त आहे. सो दीज आर ऑल द लिस्ट ऑफ कंडिशन की या प्रत्येक गोष्टीमुळे ऑस्टिओपोरोसिस व्हायची प्रक्रिया ही फास्ट होते. इमोबिलिटी असेल, काही जेनेटिक, हार्मोनल फॅक्टर्स आहेत, काही डिसीजेस आहेत, रुमॅटॉइड आर्थरायटिस सारखे, सिरोसिस आहे, न्यूट्रिशनल डेफिशियन्सीज, विटॅमिन सी, डी, मॅलॅब्सॉर्प्शन सिंड्रोम सारख्या काही गोष्टी आहेत, फार्माकोलॉजिकल, काही अँटीकोएग्युलंट्स, बरेचसे मेडिसिन जे आपण आपल्या फिजिशियन आपल्याला या गोष्टी सांगतील की कॅल्शियम कधी सप्लिमेंटेशन घेणं गरजेचं आहे. So how is the evaluation? Is a severe back pain after a minor injury also. चालता थोडा जर बसला but the back pain is more. Pain is worsening while sneezing, coughing and standing erect. Limited to a wheelchair. Mobility is कमी झाली आहे. Not getting able to go to the toilet or do my things. जेवण बनवता येत नाही, बसता येत नाही आणि थोडा वेळ जेवायला जरी बसलं तरी त्रास होतो. या गोष्टीकडे व्यवस्थित एल्डरली पेशंटसाठी लक्ष दिलं पाहिजे. स्टूप पोस्चर आहे, थोरॅसिक कायफोसिस म्हणजे कमरेतनं बाक आलेला आहे. रूल ऑफ न्यूरोलॉजिकल डेफिसिट, मी सांगितल्याप्रमाणे पायातली ताकद ही कमी झालेली असते पण ते आपल्याला लक्षात येत नाही. See the clinical consequences, kyphosis going on increasing, patient is erect first, then started stooping forward, again stooping forward. She has to take help of a walker or a stick, then she become a wheelchair bound. So this problem has to be addressed immediately when you start a back pain, neurological function, or there is a fracture after a trivial fall. So routinely we do a X-ray to see the osteoporosis चा level किती आहे, scoliosis आहे का त्याच्यामध्ये, व्हर्टिब्राची हाईट कमी झाली आहे का, वेजिंग झालंय का. यू कॅन सी दिस ऑस्टिओपोरोटिक फ्रॅक्चर आयदर इन वन लेवल, मल्टिपल लेवल, बऱ्याचशा लेवलमध्ये, पण साधारण थोरॅसिक थोरॅकोलंगर जंक्शन मध्ये या गोष्टी जास्त असतात. दिस सम फ्रॅक्चर पॅटर्न. So MRI is the diagnostic tool for determining the fracture age. There are certain signal changes in the MRI after fall also. Without fall, if there is a fracture, we have to rule out the other pathology like any cancer or infection. या गोष्टी सगळ्या व्यवस्थित बघितल्या जातात MRI मुळे. Bone scan. This is also one test your doctor can recommend you for to select the sensitivity. त्याच्या साधारण advantages असे आहेत की sensitivity जर for the detection of fracture, identify the additional fractures at other level जे आपल्या एक्सरे मधनं मिस होत आहेत and the X-ray is negative, we can find it out with the bone scan. Limitation. याला थोडी लो specificity आहे, not able to distinguish between the neoplasm and the fracture infection. So the DEXA scan is one of the tool for तुमचं साधारण लेवल काय आहे ऑस्टिओपोरोसिसची हे बघण्यासाठी DEXA scan is a good tool. So WHO ने काही क्रायटेरिया दिलेले आहेत, काही नॉर्मल साधारण त्यांचा स्कोरिंग सिस्टीम असते की -1 to 2.5 of the standard deviation is osteopenic, then less than -2.5 of the standard is severe osteoporosis. सो या प्रत्येक गोष्टीला फक्त कॅल्शियम घेऊनच उपयोग नाही, बाकीच्याही गोष्टी ऑस्टिओपोरोसिस प्रिव्हेंट करण्यासाठी काही इंजेक्शन दिले जातात. या गोष्टींनी पहिली की फ्रॅक्चर आपण जर समजा चालताना पडलो तर आपली रिस्क फ्रॅक्चर होण्याची कमी होण्यासाठी या गोष्टी करून घेणं गरजेचं आहे. रिस्क फॅक्टर साधारणतः मॉडिफायल रिस्क फॅक्टर असतात, जसे फिजिकल इनॅक्टिव्हिटी, ड्रग्स, अल्कोहोल, सिगरेट स्मोकिंग, डेफिशियंट स्टेज, थिन बिल्ड, स्मॉल पोस्चर, then less than of 10% of weight loss in men, then androgen deprivation therapy in men, previous fragility fracture. या सगळ्या गोष्टी रिस्क फॅक्टर ऑस्टिओपोरोसिस साठी आहे. नॉन मॉडिफायबल काय आहेत, एज मोर दॅन 50, फिमेल सेक्स रेशो आहे त्याच्यामध्ये, रेस, जेनेटिक काही प्रिडिस्पोजिंग फॅक्टर असतात ऑस्टिओपोरोसिस लवकर होण्यासाठी, अमेलोरिया, लेट मेनार्की, अर्ली मेनोपॉज, पोस्ट हिस्टेक्टॉमी and oophorectomy patient, they tend to have little more osteoporosis in earlier age. So all of सगळ्याच पेशंटला आफ्टर फ्रॅक्चर और फॉल सर्जरी लागते किंवा काही प्रोसिजर लागतं असं नसतं. आउट ऑफ 100 पेशंट नॉर्मल हिलिंग इज 63% ऑफ पेशंट. प्रोग्रेसिव्ह कोलॅप्स जर होत असेल, हार्ड साधारणतः 3 आठवडे ते महिनाभराने आपण रिपीट एक्सरे करून बघतो, the collapse is more if the vertebral body is collapsing. If healing, त्याच्यामध्ये साधारण 23% हील अप दिसतात. सुडोआर्थ्रोसिस म्हणजे एक खोटा जॉईंट तयार होतो, ते 14% असतं, आणि ज्यांना न्यूरोलॉजिकल डेफिसिट तयार होतो त्या लोकांनाच फक्त सर्जरीची गरज पडते. मॅनेजमेंट फॉर द ऑस्टिओपोरोसिस, मेडिकली इट्स अ रेस्ट, ब्रेस, फिजिकल थेरपी, एक्सरसाइजेस, वर्टिब्रोप्लास्टी, या सर्जिकल प्रोसिजर्स आहेत. मॉडिफायबल रिस्क फॅक्टर, व्हिटॅमिन डी चे सप्लिमेंटेशन लागतं, कॅल्शियम इंटेक व्यवस्थित लागतो, एक्सरसाइज रुटीनली केल्याच पाहिजे. आय वोंट सजेस्ट की प्रत्येक एल्डरली पेशंटला जिम, वेट्स या बाकीच्या गोष्टी जमतील, पण एव्हरी बॅक हॅज अ सेपरेट मसल ग्रुप, like neck has a separate muscle group. You have to concentrate on the separate muscle groups for strengthening it. Then quit alcohol, quit smoking. Vertebroplasty is a simple procedure to just inject a cement in a collapsing vertebra. Advantages साधारणतः second procedure एक balloon kyphoplasty असते. रुटीन जो मणका दबलेला असतो ऑस्टिओपोरोसिस मुळे, त्याला सिमेंट आतमध्ये निडलच्या सहाय्याने टाकून अंतर्गत स्टॅबिलिटी देणे, याला सिमेंट इंजेक्शन और वर्टिब्रोप्लास्टी और कायफोप्लास्टी म्हणतात. साधारणतः याच्यामुळे रिस्टोरेशन ऑफ द हाईट होतं, मणका जो कोलॅप्स झालेला आहे तो थोड्याफार प्रमाणात उघडतो. बॅक पेन 70 to 80% बॅक पेन हे इमिजिएट कमी होतं. पोस्चर करेक्शन व्हायला मदत होते. करेक्ट So it corrects the sagittal deformity, restores the lost height, improves the cosmetic appearance, reduces the risk for the neurological deficit. One thing is there, usually my recommendation, you must take a proper guidance from the physiotherapist for exercises. 4 लोक करतायत म्हणून ही एक्सरसाइज मी करणं गरजेचं आहे का, तर नाही. There are some scientific exercises that will give you a good pain relief, that will increase your flexibility of your spine. Usually what happens, आपण साधारण पाठ उघडली, जवळ कुठले तरी पाठ मान मोडणारे क्वॅक्स असतात, त्यांच्याकडनं टेम्पररी रिलीफ मिळतो, पण या गोष्टी परमनंट नसतात. समटाइम इट्स मोर हॅझार्डस. So conclusion is the high clinical suspicion in an elderly patient. या गोष्टी बघणं गरजेचं आहे की त्रास बॅक पेन का होतोय, नी पेन का होतोय, न्यूरोलॉजिकल प्रॉब्लेम्स आहेत का, या सगळ्या गोष्टी बघणं गरजेचं आहे. Do MRI if X-ray is negative. Show your spine surgeon if problem persists. Don't treat it at home. Let the doctor decide to treat it conservatively at home or you need a surgery. There is some reluctance in the patient. नाही, आम्हाला सर्जरी नकोय कारण असं झालं होतं. पण या पेशंटला नंतर प्रॉब्लेम यायला लागतात, तोपर्यंत वाट बघायची नसते. प्रॉब्लेम येण्याच्या आधी जर गोष्टी केल्या तर स्पाइन व्यवस्थित राहील. थँक्यू. Why women face more back pain than men? Is there any difference in the spinal structure between men and women? Actually, there is no spinal structural difference in male and female. Same architecture is there by God. So why there is a problem? Usually बऱ्याचदा साधारणतः फिमेल्सला उठबस, खाली वाकणे, बाकीच्या गोष्टी, घरचे काम, वर्क फ्रॉम होम असेल, या सगळ्या गोष्टी असेल तर ऍडिशनल थोडासा ताण पडलेला असतो. त्याच्यानंतर कमरेच्या किंवा मानेच्या स्पेसिफिक एक्सरसाइजेस करणं जमत नाहीये वेळच्या वेळेस, म्हणून आपल्याला फिमेल्स मध्ये ऑस्टिओपोरोसिस, लॅक्सिटी ऑफ बॅक मसल, लिटल रिलक्टन्स फॉर द एक्सरसाइज, या गोष्टींमुळे फिमेल्स मध्ये थोडंसं बॅक पेनचं प्रमाण जास्त असतं. देयर इज नो स्ट्रक्चरल डिफरन्स. Yeah, does cracking back help in relieving back pain? Yes, it gives a temporary relief. If your muscles are in spasm, facet joint get little bit locked position. So if you twist or crackle it, it will relieve your back pain or relieve your spasm. It will give you good relief for some time. See, brisk walking or jogging, what is better for back pain? See, you're walking, a brisk walk or a jog, that thing is going to help much for your heart and lung. Back pain related issues, there are separate exercises for your back strengthening. It has some contribution for your say generalized stamina, then heart lung disease, everything that will be okay with. But back pain, you have to do separate exercises for the core development of the muscle development of your back. स्पॉन्डायलोसिस कोणाला होऊ शकतो? स्पॉन्डिलोसिस थोडीशी ग्रॉस टर्म आहे, डिजनरेशन ऑफ द स्पाइन, याला स्पॉन्डिलोसिस म्हणतात. इट कॅन स्टार्ट विथ युअर डिस्क डिजनरेशन, डिस्कची हाईट कमी होणे, फॅसेट किंवा जॉईंट्सवर लोड येणे, तिथे थोड्या प्रमाणात सूज तयार होणे, या गोष्टीसाठी ही स्पॉन्डिलोसिस जनरलाइज टर्म आहे. तो कोणालाही साधारणतः सेडेंटरी लाईफस्टाईल असेल तर अप टू द एल्डरली पॉप्युलेशन, या सर्वांमध्ये स्पॉन्डिलोसिस होऊ शकतो. इट्स बेसिकली अ डिजनरेशन ऑफ युअर स्पाइन इज अ स्पॉन्डिलोसिस. When should someone consider for back pain? See, I will advise for the surgery if there is a failed conservative treatment. Means आपण सगळ्या गोष्टी करून बघितल्यात, आपण फिजिओथेरपी केली, सायंटिफिकली फिजिओथेरपी केली आहे, एक्सरसाइज करतोय, पेन कमी होत आहे, बट आपलं बॅक पेन कुठल्या कारणाने ते करणं गरजेचं असतं. इफ इट इज ऑस्टिओपोरोसिस रिलेटेड बॅक पेन, द ट्रीटमेंट इज डिफरंट. इफ इट इज स्पॉन्डिलोलिस्थेसिस म्हणजे मणका सरकल्यामुळे जी गोष्ट आहे त्याच्या बॅक पेन जर असेल तर त्याच्या सर्जरी त्याच्या वेगळ्या असतात. सो बेसलाईन वी हॅव टू फाइंड आउट what is giving you the back pain, what is your MRI or X-ray saying, and what is the pain generator. If the osteoporosis is your pain generator, we have to treat it first. सर, माझे अंकल लहान मुलांकडून बॅक टेकून घेतात आणि त्यांना रिलॅक्स फील होतं, हे टेम्पररी पेन असेल की काही काळजी करायची गरज आहे? सी, परत आपण साधारणतः उदाहरणार्थ खातल असं आहे की आपण हे जे मलम, तेल वगैरे या गोष्टी लावतात, हे काउंटर इरिटंट असतात. तसेच लहान मुलांकडनं पाय देणे ही गोष्ट सुद्धा टेम्पररी स्पॅझम रिलीव्ह करण्यासाठी वापरली जाते, पण हा एक लॉंग टर्म सोल्युशन नाहीये. लॉंग टर्म मध्ये तुम्हाला एक्सरसाइज करणं गरजेचं असतं, फ्लेक्झिबिलिटी स्पाइनची वाढवणं गरजेचं असतं. या गोष्टीमुळे टेम्पररी रिलीफ मिळेल, पण ही गोष्ट ऍडवायजेबल नाहीये अंटिल अनलेस समजा ऑस्टिओपोरोसिस असेल तिथे आणि मुलाचं वजन पण जास्त आहे, तिथे रिब्स किंवा इथे चुकून पाय दिला त्याने जोरात, फ्रॅक्चर व्हायची पण शक्यता आहे. सो आय वोंट ऍडवाइज की पाय कंबर दाबून घेणे हे व्यवस्थित नाहीये. When to take back pain seriously? You have to take every back pain seriously. If it doesn't subside with painkiller, some physiotherapy, थोडं बॅक पेन झालंय, स्पॅझम आलाय, गोळी घेतली, व्यवस्थित वाटतंय, ठीक आहे, पण याच्यातनं आपण धडा घेत नाही की हे परत बॅक पेन होतंय मग मी परत गोळी घेणार. या गोष्टीमुळे बॅक पेन कशामुळे ही गोष्टच विसरली जाते. सो for everything you need to take medicine, you have to take physiotherapy, and you have to do complete back strengthening exercises, I'll say lifelong. It will delay your disc generation if you start early. लोअर बैक पेन क्यों होता है? See, there are n number of causes for your back pain, starting from the mechanical back pain, disc related issue, joint related issue, then laxity of the muscle, obesity, nutritional deficiency, vitamin D deficiency, calcium deficiency. So simple thing is a back pain. Back pain will happen either because of lack of exercise, obesity, and your ignorance for the exercises. Can you suggest some easy to do back pain? Can you just ask it little clearly? Sir, I do gym, then I also get back pain. Why and what to do? See, first thing, going to the gym, doing cycling exercises, doing treadmill, and if you are a gym person, then I will not suggest to lift the free weights with your spine at flexion. That will give excessive load on the disc, and there are some tears in the disc, as I mentioned previously. These tears usually give back pain more. Plus, in gym, you are just doing upper and lower body exercises, but the middle area for the flexor and the extensors of the spine, thoracic muscle, that thing will not get a complete strengthening until and unless you get a proper training from the physiotherapist for strengthening your back. Can a slip disc be permanently cured? Yes, slip disc can be cured for a time being until and unless you take care of your slip disc for lifetime. You can do a surgery for a permanent relief for your pain. But what about the, say, after 5 years, if you are pain free and you are doing same things for the ignorance, for the exercise, lifting weights, traveling too much, insulting your back, the disc can happen at the same place even after surgery also, at the upper level, if you are not too cautious about or too worried about your back. Can you suggest some easy to do exercises for your back pain? Right. There are certain exercises that our team member from the physiotherapy, they will explain you about what kind of simple back pain exercises you can do at home. Can I get back pain when I cough? If you are a gym person or your job is to lift weight or you are traveling on a two-wheeler, there is a typical kind of pain in your back when you cough or sneeze, or there is a back spasm. We'll just find out if there is a failed conservative treatment. First thing, we'll give exercises set, some painkiller, and this issue will be solved with the physiotherapy only. If the pain is persistent and it is giving you a trouble in your day-to-day life, I think first it should be investigated earlier. मणक्यात गॅपचा प्रॉब्लेम एकदा ट्रीट केल्यावर परत तोच प्रॉब्लेम व्हायची शक्यता आहे का? होऊ शकतो. मणक्यात गॅप बऱ्याच ठिकाणी सांगितलं जातं माझ्या मणक्यातला गॅप वाढलेला आहे, पण तो गॅप कमी झालेला असतो. इट इज बिकॉज ऑफ युअर डिहायड्रेटेड डिस्क. एकदा तो प्रॉब्लेम झाला, टेम्पररी आपण एक्सरसाइज केला, फिजिओथेरपी केली, मग आपण त्याचा विषय सोडून देतो. आपण परत त्याच गोष्टी करायला लागतो. बेंडिंग फॉरवर्ड, लिफ्टिंग वेट, इन्सर्टिंग युअर बॅक, या सगळ्या गोष्टी झाल्या की तो प्रॉब्लेम परत तेच येणारच आहे. कारण नेचर विल नॉट लीव यू until and unless you start respecting your spine. नैसर्गिक प्रक्रिया ती चालूच राहणार आहे डिजनरेशनची. जॉईंटवर प्रेशर येतच राहणार आहे, डिस्क हर्निएट होत राहील जर तुम्ही व्यवस्थित त्याची काळजी घेतली नाही तर. Any neck exercises for avoiding neck pain? Yeah, we'll have a separate session for that. For a chronic back pain, is the surgery the only treatment? No. First thing, I have explained you about the progress of a spine problem. We have to see ourselves in which stage we are. If there is a muscular imbalance, there is a disc degeneration problem, there is osteoporosis, there is a facet syndrome, and these things can be treatable without surgery. So, acute back pain, if you have a reluctance for everything, medicine, physiotherapy, and you have a long sitting hours, you are not taking break, your food is not proper, it will go in a chronic back pain. Because if there is no strengthening of your back muscle, the entire load is coming on your central column of the spine. So there is higher chances of getting it dehydrated, disc I mean to say, and it will lead to a chronic back pain. Things will again lead, if you have a reluctance for exercise, it will again lead to the nerve compression. That time we give a proper trial of physiotherapy, injection, everything. And the last part, all these patients whom we have tried physiotherapy, medicine, exercises, postural training, they fail. Usually these patients require surgery. Thank you. Chalo.
about the various causes of back pain. There are a lot of them, but today, what in the prevalent times of COVID, the most relevant reasons of back pain today are two. We stress upon those two today. One is biomechanical back pain, and one is back pain arising due to stress. Now, what do I mean by biomechanical back pain? Biomechanical back pain simply means there is no structural problems with the spine. There is no nerve root compression, there is no disc herniation, there are none of those structural issues arising, but still you have persistent back pain. Why does that happen? This back pain simply arises out of imbalance in muscles, poor muscle tone, postural inconsistencies, muscle imbalance. Why do these things happen? Right now, we are all facing uncertain times of corona. We are all stuck at home. Most of us are working from home. Working from home involves a lot of sitting, sedentary, job-related, profiles where a lot of work on the computer is done. Laptops are being used. You're sitting for hours together. These are the main reasons why back pain is arising. Back pain arising due to this reason is what we know called as biomechanical back pain. Now, if you just Google back pain, you Google posture, you'll have lots of literature available as to what is the correct posture, what is, biomechanics, and lots of technical terminologies all out there for you to see. What we are trying to do today is to give you practical tips on how to make your work environment at home easy, pain-free, and without spending too much money. So let's start with the sitting posture. Usually when we are sitting, most of us may not have an ideal chair, an ideal workstation available, which is present in the offices. So how do we go about modifying and working with what we have? All right. Now, what I'm going to do is demonstrate to you the incorrect postures first, and then we modify it with what we have available over here and make it correct. Okay. So I'm going to call upon my colleague, Dr. Mansi, who's going to demonstrate the sitting postures first. Mansi. All right. So now we are going to start with Mansi sitting in the way most of us sit while working, which is absolutely incorrect. All right. So move forward. And all right. Now this is the position most of the times we are working in. What is wrong about it? Everything. All right. Look at the position of the neck. It's a bent forward position. Persistent holding of the neck in this particular position is obviously going to cause neck pain. The back is unsupported. Sitting like this for hours together is a no-brainer. You are going to land up with back pain. Similarly, the position of the laptop. Most of us do not work on desktops these days. We are using laptops. Look at the position of the laptop. Her neck is bent forward simply because the screen is at a lower position than she is. All right, how do we change this position and how do we make use of things available to us without buying new things? First of all, let's start with the chair. Now, ideally, the chair should have a back support. All right. In spite of having the back support, she is not using the backrest. So what do we need to do? Any sitting surface, irrespective of whether it's an ergonomic chair, a normal chair, your dining chair, whatever surface you're sitting on, always remember the entire width of the surface is to be used. What do I mean by that? What I mean is you need to push right at the back of the chair to the edge and then lean backwards. Utilize the entire width of the chair with what we call as the pelvic thrust and then lean back. After that, you have to make sure the distance between your work surface and your sitting surface is minimal. So she's going to move the chair closer to her work surface in such a way that even if she can't use the armrest, she is able to use the surface of the table to rest her arms. Remember, maximum arms resting causes minimal neck pain. The minute you are working with unsupported arms, the pressure from the hand, these are the smaller joints, you're working with them continuously, the pressure keeps getting transmitted to the larger joints, one of the reasons for neck pain. So we modify it by going closer to the workstation, resting the forearms on the table. Now we come to the screen. The screen, because of her height, it's at a lower level. What simple thing, any books lying at home, the famous yellow pages which nobody uses these days, if you have it lying around, take that, place it below your laptop, adjust the screen in such a way that you are eye level with the top of the screen. All right. Now her arms are resting. She's able to use the laptop and her neck is in the neutral position, back is resting, forearms are resting. This is the most ideal position that you can do with the things that are available at home. Now, in spite of this, if you feel the forearms are still not supported enough, the best option would be if you have a keyboard, attach it to your laptop, push the laptop a little further away, and now you have the most ideal position for working. Remember, as many unsupported body surfaces are present, that much back pain is likely to happen. Support your hands, support your arms, support your back. That's the idea to minimize back pain. Also, another thing to remember is the position of the legs. The height of the chair should be such. Bring the chair up. Height of the chair should be such that your hips and knees are at 90 and the feet are always touching the floor. In case you are not able to adjust the height of your chair, you do not have an office chair at home, you are using a dining chair for work purposes, no problem. Here we can just take a pillow which is at home, put it on the floor, rest your feet on the. That's it. That's all that's needed. Any surface which you available at home, use it to support the feet. The feet should not be hanging or just toes touching the floor is not an ideal position to work. Also, prolonged crossing of legs and sitting, which is another very common positions adapted for work at home, will also cause a lot of compressive forces acting on the spine. All right, so as far as possible, keep your legs and hips and knees to 90 with the feet supported. All right. Now, we do get patients sometimes telling us that, ma'am, we have, invested so much money in all this office furniture and we are using it, all the best furnitures and all, and we still have back pain. Why does that happen? Because remember this, no matter how expensive your furniture is, the body requires a break from a static position. Sitting loads the spine maximally. So if you are going to be sitting without a change in position, no matter what furniture you are using, you are still going to get back pain. All right. So it's extremely important that no matter what your furniture, how ideal your work surfaces are, you need to break the position. Now, a lot of times there are people telling me, ma'am, we have deadlines, there is no way to take a break. We cannot get up. Ideally, the WHO guidelines say that after every 30 minutes, you're supposed to change your position by getting up, moving, walking, and then sitting again. Now, we know that every 30 minutes, this is not possible. So what is it that you can do in place without getting up and still give your back a little bit of reprieve? Simple stretches, simple exercises. In place without moving, okay? First of all, every 10 or 15 minutes, look away from the screen and blink a few times. This is basically to rest your eyes from constant staring at the screen. Next, what you do is stretching exercises. Because you have been typing a lot of time, a long time, do simple stretches. Yeah, these are simple stretches you can do in place. Then we come to the neck. So neck, just simple movements, right and left, to the side. Okay. You could do this every 5 minutes, 10 minutes, or at least after 30 minutes to make sure that the back is rested. Now, a very important and a very relaxing stretch in the sitting position is you move to the edge of the chair, move to the edge of the chair, hold on to the sides and stretch your spine backwards with the legs extended. Remember, you have been in a flexed position for a very long time. So you need to do a stretch in the opposite direction. And if you are unable to get up from your position, this is the best stretch that you can do. If you do this every 15 minutes, 20 minutes, 30 minutes, your body is relaxed, your joints are not feeling cramped anymore, and you're able to work again for a longer time. All right. So these are the most common things that you could do while you are sitting and working for long hours. Now, another very important thing, and amongst the job profiles and patients who come to us, I've realized is there are a lot of jobs which require taking calls. You are not necessarily typing, you're not necessarily doing any handwork, but you're talking and you're taking calls. Ideally, when this kind of a scenario happens, try to stand, use a hand-free mic, stand, walk around a little, then sit again. So idea is that break your position from whatever position you are in for a long time. So if you've been sitting for say 40 minutes or an hour or so, first of all, it shouldn't happen. But if it has happened and the next thing that you're doing is taking a call, please stand. Take the call while walking around and then sit again. These are simple things. You don't need to, invest anything in this. Most of the things are available at home. Also, in case you really want to invest and you are planning to work from home for a very long time, even when hopefully COVID is gone, there are standing workstations available. What do I mean by a workstation? Standing workstation simply means they are much higher. I think Amitabh Bachchan has it. Check his Instagram. He uses it a lot of times. So it's a table which is at a much higher level. You keep your laptop on that and you're doing the same work that you're doing in sitting in the standing position. So whenever that option is available, you could be doing that. Use that workstation intermittently along with your sitting workstation. So these are simple guidelines for work from home, and not just work from home. Even when you go to the office, in spite of having an ideal workstation, we are not always using it correctly. So learn to use what you have correctly. That is important. But most important of all is to take a break. There are softwares available. Put them on your, or put alarms on your mobile for every 30 minutes. I'm not saying take a break, for after working 30 minutes, take a 30-minute break. No, the bosses will kill me. That's not what I'm saying. Please. What I'm asking you is change your position for 5 minutes after you have been sitting for 30 minutes. Okay? Simple exercises. We have demonstrated a few in the sitting position. We'll show you more stretches in the standing position so that you know what you need to do when you're taking that break. All right. So let's now move on to the standing position and we'll show you the stretches in the standing position.
I'm physiotherapist. Today we are going to discuss about postures, some of the faulty postures in sitting, in standing. Okay. So why we need to look for the postures in standing? Because some of the jobs also demand a long standing posture. So what is the ideal posture? First of all, ideal posture is straight. Your ear, it should fall over your shoulder, shoulder over the hip, hip over the knee and your heel. This is the ideal posture. Okay. But due to work or something, we mostly adapt the faulty posture. Okay. For the let us discuss about the faulty postures. So first of all, forward head posture. Forward head posture मध्ये neck आपली पुढे जाते. Okay. त्याच्यात chin आपली poked out होते बाहेर. So in this, the upper neck muscles are tightened, the back muscles are stretched, and it gets weak. These postures we can correct with some of the exercises, which will show at the end of this session. Okay. Now, second is the uh, rounded shoulder. Okay. In this, the back muscles are back, the shoulder and the back is rounded. Okay. The back muscles are stretched and it gets weak. The front muscle of the chest are tightened and we need to stretch it. Okay. Third is the lordotic posture. In the lordotic posture, there is excessive curvature of the lordotic spine. Okay. In this, the back muscles, the low back muscles are usually shortened and tight. Okay. Along with this, the muscles which are present in the front of the thigh, it gets tight. The abdominal and the glutes muscles are weak. Next is the sway back posture. Sway back posture मध्ये पाठ मागे जाते. In this, the shoulder, it can it lies beyond your sorry, the hip lies before your heel and toes. In this, the glutes get switched off, and we have to target the glute muscles to improve this posture. Some of the exercises which we can do in the posture shown by Dr. Aditi Thakur. So in standing, we can do some of the stretching exercises to improve the posture. In this, you have to just पाय वरती घ्या. एका पायावरती बॅलन्स करायचं आहे. Hold this for 10 counts at least. Now second one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. त्याच्यानंतर you have to raise. Hold this position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. त्याच्यानंतर आपण टो वरती पण वॉक करू शकतो. So this will release the tension over the muscle. Next exercises which we can which will improve the faulty postures are demonstrated in lying position. Yeah. So just as Dr. Pradini mentioned about how standing posture needs to be adjusted in the most ideal way possible. Now understand that it's not always possible to be in the correct position all the time. What you need to remember are simple tips. There is a way to get your body aligned. How do I understand my neck is forward? If you are working on the computer for a long number of hours, if we are using the mobile for a long time, which of course all of us do it, me included, so we are going to have a forward neck posture. Just understand this and accept it that you do have a forward neck posture.
The minute you have a forward neck posture, that basically means the rest of the spine is going to get disaligned. What do I mean by disaligned? Just what Dr. Pathak said, the minute. Also remember this, and I think the doctors have, explained this to you, that a spine is a connected structure. It's not the neck vertebrae are separately hanging, the thoracic is hanging separately, the lumbar is hanging separately. It's not that way. It's a connected structure. It's like a building, okay? It's a block of buildings. Anything happens on the top floor, the foundation is going to get affected and vice versa. Apply the same principle to your spine. Anything happening to your neck over here is going to cause a problem in the mid back, low back, and all the joints going below. Alright? So how do we, let's concentrate on the forward neck, because that is the most common problems found today. How do you correct the forward neck? There is a very simple exercise which you could do it all the time while you are at your desk, while you are standing, while you are sitting. It's called the chin tuck. What do I mean by chin tuck? Chin tuck simply means, once you remove your mask. Okay. So what I need to do is, let's look at the profile. In case she is in this position, the forward neck position, the chin tuck, I'm placing my hand below the knee, below her chin, and asking her to press back. When she presses back, the neck is getting aligned with the spine. This is your chin tuck. Now she'll hold this position for 5 counts and then relax. Now when we relax, we don't mean you go back to your forward posture. You do your chin tuck, hold, and just relax in position. In case you are unable to understand this movement in the beginning, do it with feedback against the wall. So stand with your back completely touching the wall. The neck, see that my hand is passing through this. Alright. Now what I'm going to ask her to do is try to take the neck towards my hand. Obviously it can't touch, but that's the movement she needs to do. Hold it for 5 counts and relax. Do this intermittently every 10 minutes, 15 minutes, while you're sitting, while you're standing, wherever possible. It doesn't take too much time. Just keep doing it so that the muscles are activated both anteriorly and posteriorly at all times. Remember, we are overusing our back muscles. Okay, our extensors are being overused all the time. So you need to make sure there is a balance between your anterior muscles and posterior muscles at all moments of time. And these are simple stretches that we were demonstrated right now. Remember the first segment when I spoke about taking a break? We showed you some stretches in the sitting position. These are the stretches which you can do while you are standing. When you're taking a break of 30 minutes, after 30 minutes or 45 minutes, you are able to get up, walk around. But instead of just walking around, do something. What do? These were the simple stretches. Like you come up on your toes, you come up on your heels, you do toe walking, do heel walking. The front of the thigh muscles, the quadriceps, you can do this stretch. Okay, simple things in your place, just stand up, do these, but it will help to relax the muscles overall. Alright? Now, important thing to remember here is that some of these stretches, please remember this, that we are talking about biomechanical back pain, alright? The pain which origins only from weak muscles. Some of these stretches, some of the exercises that we demonstrate may not be allowed for patients. Now, what do I mean by the word patients? When I am using the terminology of a patient, I am talking about people who have a back problem which is pathological, which arises from a vertebral problem, from a nerve problem, some structural issue when it is present. You have to make sure the therapist and the surgeon are coordinating about what exercises and stretches are to be done and not to be done. Everything that we demonstrated right now is only pertaining to biomechanical back pain, which is basically arising from muscle imbalance. Alright. Now let's take a look at a lot of stretches which you can do in the lying down position, and also some basic exercises to engage your core. Remember, again, like I said, imagine an electric pole. Alright. An electric pole, to be able to remain erect requires wires from both sides. Only when the tension between the two wires on both sides is equal, the pole remains erect. Correct? Any part of any wires on either side, the tension getting tightened or loosened, the pole is going to shift. Imagine the same scenario with your spine. The spine is the pole. One set of wires are your anterior muscles, one set is the posterior muscles. For the spine to remain correctly aligned, both these muscles have to work together. Now, because we are overusing this, we get tired and you start hunching forward. A lot of times, especially women, unfortunately, lose abdominal muscles. Actually, that's a very sexist remark. I take it back. Men also have big bellies. So, this position arises when the tone here and here there is a problem. Alright? Simple guideline before you lose the fat or before you get the correct muscle tone, so to speak, is learn to engage your core. What do I mean by learning to engage your core? Usually when we are walking, we leave the abdominal muscles loose. Most of us walk like this. Alright? Yeah. So all this is loose and you're just walking, alright? Which is why there is pressure here constantly. When you're walking, just very consciously contract your stomach a little bit, just a little bit. Okay? I'm not asking you to do this because then you can't breathe. Just engage slightly so that both muscle groups are activated, both your wires are in equal tension, both are activated, and your spine is relaxed. At every point of time while you're walking, it's a very simple thing to do. Just engage, consciously engage. Don't leave it loose. That's what we are asking you to do. Okay? These are simple tips on maintaining a correct posture when you are standing. Sitting, we spoke about. We are ready for all your Q&As at the end of the session. But for now, let's move on to a segment of lying down, doing some stretches, and also some simple exercises which help you to get that tone in your core muscles. Okay, I'm going to hand over the session to Dr. Aditi for the next round of session. Okay?
Hello everyone, I am Dr. Aditi. As we are discussing about the biomechanical low back pain, most common reason being the bad postures or the faulty postures. Now we'll see the simple exercises to prevent the biomechanical low back pain or to maintain a good posture. So these exercises are only and only for biomechanical low back pain and not for any other medical conditions. Okay, so let's begin. So before going to the strengthening of the back muscles, let's first see how we can activate the back muscles and the muscles which support the back or the spine overall. So first two exercises I'll be showing are static back exercises and static gluteal exercises. So for static back exercises, the person has to lie on his back and he has to press his shoulders and heels both at the same time on the bed and hold for 5 to 10 seconds. Just press, hold, hold, relax. Let's do this for one more time. Again, hold, hold, and relax. While doing this exercise, you have to continue your normal breathing and not hold the breath. Okay. Now for the static gluteal exercise, that is your seat muscles, the person has to lie on the stomach. And in this position, the person has to contract both the gluteus or both sides of the seat at the same time. Just contract, hold it for 5 to 10 seconds. And relax. Let's do that. 1, 2, 3, 4, 5. In the same way, continue your normal breathing. Come on your back. For activation of back and gluteal muscles, there is another type of exercise we can do. That is pelvic tilting exercises. Bend both of your knees. And press your lower back down. So in this position, what you have to do is, our lumbar curve is like that when you're lying on your back. Okay, so you just have to straighten your lumbar curve and press it on the bed. Okay, so just press, hold, hold, relax. Again, press your lower back, continue your normal breathing, hold, and relax. So this is for the activation of the back muscles and the gluteal muscles. So now we'll proceed with the twisting part of the spine. So what we can do in this position only is turn your neck to one side and your knees to opposite side. Just turn and hold. 1, 2, 3, 4, 5. Come to normal position. What you can do is, you can keep your arms like this for the stretching of the quadratus lumborum and your back extensor muscles. Turn your neck to opposite side and knees to opposite that of the neck. Just hold 1, 2, 3, 4, 5. Relax. So this was for the light stretching of your lower back muscles. Then we'll go for the bridging exercise. Bridging is most commonly used for the back extensor strengthening, and which is most commonly used in the gyms and normal workouts by many people. So you have to tuck your tummy inside to engage the core muscles and then lift your lower back and seat up as much as you can, but do not make any alterations in your normal lumbar curve. Just do it upwards. 1, 2, 3, 4, 5. Down. Let's do this one more time. Up, hold, hold, and down. Okay. Now on improve line. So for the next exercise, what I meant by neutral spine is you have to just maintain your normal curves. How we discussed about the normal posture or a good position for spine, that you have to maintain. Like the normal lumbar curve is just the normal curve. If you are extending your back, then you are increasing your normal lumbar curve. So it will be like this. So we don't want that. So while you're doing each and every exercise, you have to make sure that you are maintaining your normal lumbar curvature, right? So for that, you can do all the exercises in front of the mirror. So you can get a normal visual feedback of yourself, for yourself. Okay. So next exercise is back extension exercise, or we can it is commonly known as Bhujangasana or the cobra position. So for that, the patient has to lie on the stomach. The hands should be at the shoulder level, and by pushing your hands down, you should come up with your back completely. Yes. So this is the ideal Bhujangasana or the cobra position. This you know, this position is this exercise is to maintain the normal lordotic curvature of the body. Many a times it happens because of the working postures or in sedentary jobs. We lose our normal lumbar curve. So to maintain that and to reduce the back pain, this exercise is very important. Let's do it one more time. Yes. Hold. 1, 2, 3, 4, 5. Done. So initially, if you are having pain because of the bad posture, then you don't have to go for the complete extension of the back. Okay, so in that case, you just rest your elbows down, push your elbows down and come up in a halfway. You don't have to do this completely. Just do this halfway and return back to your normal position. But again, if your back pain is only and only because of your bad posture, or it is a mechanical low back pain as diagnosed by a doctor, then only you should proceed for this exercise. Otherwise, just skip this one and let's do the other one. For cat camel. Now the next exercise is cat camel. So for that, the patient has to be in on all four limbs, or the quadruped position, as we say that. So in this position, what patient has to do is lower the lower back, or make it arch, the lower one, and hold it for that, like a cat. 1, 2, 3, 4, 5. And then after this, like a camel, patient has to hunch the back, or the make it like a hump and hold it. 1, 2, 3, 4, 5. Again, cat, lower down, lower down. 1, 2, 3, 4, 5. Camel, up, up, up. 1, 2, 3, 4, 5. Relax. So this exercise is for your upper spine muscles. So to maintain the flexibility of the upper spine, this exercise is very useful. Now let's see some simple stretches for your overall spine health, we can say. First is lion stretch. For that, the patient has to be in quadruped position, the same as cat camel position. The hands should be completely perpendicular to your shoulders, and your knees should be completely perpendicular to your hips. In this position, what patient has to do is just sit back on the legs and go down with the head and neck and stretch the shoulders completely. What happens in this position is your lower back is stretched, as well as your shoulder girdle muscles are also being stretched. So this is the stretching exercise for the whole back. Just hold this position for 20 to 40 seconds and then come to normal position. Let's do this one more time. Just go back and sit. Hold the position. Again, come on. Down. Now we'll proceed for the hamstring muscle, stretching of the hamstring muscles. Okay, just lie down. Hamstring muscle is a very important muscle because it is commonly known as the muscle responsible for back pain in many for many a times. So for that, the patient needs to be in a sitting position. Because if the hamstrings are tightened, then they pull the hip joints they pull the hip joint backwards, and so it changes your lumbar curvature. What we talked about previously. So it changes your lumbar curvature, and so the pain occurs. So for that, we have to make sure that we are stretching our hamstrings regularly. So for that, you need a stretching bed. The patient has to be, or the person has to be in a sitting position against the wall or any back support. I'm tying this to the feet, and the person has to just pull the stretching belt and feel the stretch on the posterior aspect of the lower limb. Okay. After feeling the stretch, hold the position for 20 to 40 seconds and then relax. Let's do it one more time. Pull, 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 hold, hold, relax. So this was for the hamstring stretch. Now we'll proceed for the piriformis muscle stretching. Piriformis is one of the problematic muscles in the body, as we can say, because the sciatic nerve passes through the muscle, and if the piriformis gets tightened, then the sciatic nerve squeezes. So it gives the symptoms of sciatica like pain and tingling in the lower limb. So to avoid that, the piriformis should be stretched in a regular workout. The patient should lie on the back. The knee should be bent, and the patient will be on the back with the cross-legged position. The person should hold the lower limb and just pull it towards herself. Pull and hold. She'll feel the stretch over the gluteal muscles. Hold for 20 to 40 seconds and relax. One more time for that leg. Yes. Hold the lower leg. Pull, hold, relax. So this was for the piriformis. Now we'll proceed for the quadratus lumborum muscle. Quadratus lumborum is also very important muscle when you are doing the lifting or twisting movements. So it is very much important to stretch that muscle and keep it in his good health to avoid the spine injury by lifting or twisting. So for that, the patient has to again lie on the back, one leg folded, the hands stretched outside, and the patient has to rotate his limb to one side and extend the knee. And then let's gravity do its work and just lay it like that, hold it, then again bend the knee, come to the normal position, and that's it. We'll do it once more. Just bend it or rotate it, extend the knee, and leave it like that. Hold it for 20 to 40 seconds, and then to normal position. This was quadratus lumborum. Now, the last muscle for the stretching is psoas major. For that, the initial position of the person should be in lunge position. So, in lunge position, the patient has to put the front leg little bit forward, and then just put all the body weight on the front leg and stretch the stretch the leg that is behind. And hold it there. Hold it for 20 seconds and move back. Then again, hold, 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 back. So this particular exercise should not be done for the patients who are having any knee problem or recent knee injury without the advice of the physiotherapist. So these were the simple exercises that anyone can do to prevent the biomechanical low back pain or to reduce or to improve the good posture. So that was it for my session. Now I'll hand over the session to Dr. Fatema Parasnis. Hi. Okay. So, I know this question is going to come up in the Q&A. So, let's get it out of the way right now itself. What is the correct lying down position? How do I sleep correctly? This question is definitely going to come. So, let's tackle it. I can, since I can demonstrate it to you better, what right now, remember, even when you're lying down, the principle of alignment remains the same. What do I mean by that? Simple. Head, the entire spine, starting from the head, neck, shoulders, upper back, lower back, hip, knee, ankle. Everything should be aligned correctly. All right. Now, a lot of times, especially because we don't want to get rid of our mobiles even when we are going to bed, what are we doing? This is the position we are in. Okay, there's a mobile. Just give me. Thank you. Okay, so this is what you're doing. Now I don't need to tell you what is wrong about this. Everything is wrong about it. All right. Persist. The neck is in the forward position again. Prolonged, prolonged use of the mobile, or even if you're reading or watching TV, this is the position you're most likely to adapt. All right. Now, if you fall asleep in this position through the night, every time you're sleeping, this is obviously going to cause stress on the neck. And remember, again, stress to the neck is coming over here. Okay, it's coming to the low back also, and it is passing on. All right. So, what we need to do now is we need to correct this position. How do we correct this position? First of all, you need to adapt to the position you use for a longer time. What do I mean by that? We obviously, when we are asleep, we change positions. Sometimes you're lying on the back, sometimes we turn on the sides. But we need to adapt to the position we sleep in for a longer time. Now, most of us sleep on the side for a longer time. But if not, and if you happen to be the ones who like to sleep straight, there are some changes which you need to do to this particular position. Now, what do I mean? First of all, ideally, when you're lying down straight, you shouldn't be using anything below your neck. All right? Because when you have no pillow below your neck is already in alignment with the back. Okay? It's already straight. What I'm trying to say is the spine is already straight. But in case you are used to having something below your neck, make use of something which is very, very thin in height. Height of the pillows is the most important thing to acknowledge when you're sleeping straight or when you're sleeping on the side. Whichever position you're sleeping in, it's the height of the pillow which is important, irrespective of how expensive a pillow you're using. Starting from the the Dunlop ones to the cotton ones to the memory foam ones, whichever brand you're using, doesn't matter. It's the height which is important. Now, what do I mean by height? I mean that when I'm going to be placing the pillow here, first of all, the pillow, this whatever you're using, it could even just be a bed sheet. It should be such that the head, neck, and shoulder is supported. Even if you're using a thin surface, but you do this, see what's happening. The unsupported area over here is going to cause stress on the spine. All right. So whatever you place below your neck, it has to go all the way to your shoulder, and the height should be such that the neutral spine that Dr. Aditi spoke about is maintained at all times. All right. The spine needs to be in alignment. Now we have taken care of the neck, but look what's happening over here. Because the legs are straight, remember, even when we are standing, we have a normal curvature at the low back.
that curvature is normal to have, but it does cause stress on the low back. So whenever we are lying down, at least we need to make an effort to relax the spine as much as possible. You know, there's a very famous saying which says your spine only rests when you're dead. So what do I mean by that? I simply mean that even when you're lying down and when you're sleeping, your spine is still under stress. So how do you correct it? For the low back pressure that is there, take a thick pillow. Again, I'm talking about thickness of the pillows at all point of time. Doesn't matter what pillow, but pay attention to the thickness. All right. You take a thick pillow. Ideally, what is best to be used are the bolster ones. You know, I think in Marathi they call it load. Load. I think it's called in Marathi. That if you have at home is the most ideal thing to be used. Place it exactly below the knees. I'm again saying it, below the knees. Please do not do this. This is not what I am saying. All right. This gives me a lot of patience, but this is not what we want you to do. This is what we want you to do. Okay. The load or the bolster or just a normal pillow comes below the knees. The minute you place something below the knees, what is happening is there's a slight flexion or bend coming in the knees, which is helping to relax the spine. Okay, it's the same principle which happens when you're standing and doing a single leg stretch. When you do this stretch, your low back, the curvature becomes straight and your spine feels rested. That same thing is happening right now. So this is the most ideal position to lie down in, especially if you've had a long day, you have, stood for a long time or you have been sitting for a long time and, you just feel tired at the end of the day, and that back pain which you feel because of being tired, you can always rest in this position. It's the best position to lie down in. Now, supposing you're amongst the people who sleep on the side, how do we make changes for that? Now, when she's going to turn on the side, look what happens to the neck. All right. There is a pillow, but is it helping in any way? It isn't. Look at the angle of the neck. It's wrong. All right. Then invariably, what do we do? It is obviously not a natural position. It is not comfortable. What do you do immediately to make up for the difference in the height? Very good. The crew here is very smart. They're showing me they're going to place their hands over here. Okay. This is what we do. All right. This for some time is fine. Every single day for years and years, if you're going to do this by itself is causing a lot of compression. Okay. Then you get patients who are like, haat dukto ani mungi eto, and all of that happens. Okay. This is the reason. Okay. So again, height of the pillow is important. How do you change this? Simple. Okay. Get the correct height pillow. Now, once the height of the pillow is correct, she can just place her hand unsupported, not supporting the neck on the side. Okay, right now the hand is still on the side, comfortable, but it's not getting compressed. All right, and while sleeping on the side, make sure your knees are bent. Okay, this naturally takes care of the curve at the low back. The back becomes flat, and this is a comfortable position. Another very comfortable position to lie down on the sideline is, let's just come towards me a little. Take a pillow, place it on the side. All right. This is especially for people who are in the habit of sleeping on the stomach. There is no adjustment for that. Okay, it is bad for your spine. Everyone here is smiling, so I know they're doing it, but there is no way to manage it. The best possible option for people who are used to sleeping on the stomach is stay on your side, place a thicker pillow also if you want on the side, take the leg above, cross it over. All right? Are you comfortable? Okay. Comfortable, you get a sense of, having turned more, but at the same time, you're not on your stomach. All right? Your spine is completely well aligned. Okay? So these are your sleeping positions, the most ideal positions. Yes, how do I know when I'm turning on my back and when I'm turning on my hip? No, you cannot know. There are people, including Dr. Parasnis, who does this. He keeps changing pillows when he sleeps straight and when he sleeps on the side. He does it. Okay? Even in deep sleep, he keeps on changing. That's what being a spine surgeon is all about, I guess. But he keeps changing the pillows when he's sleeping straight and when he turns on the side. But most of us are human, we can't do it. So adapt to the position you use for the longest time. If you are used to sleeping on the side, make those changes. If you're used to sleeping on the back, make those changes. Alright, so this is all in brief about your lying down position. Of course, I will be taking a lot of questions post session, but I'm sure this is the question which is going to come up. So, a brief this thing. Also, another question which is going to come up, let me get it out of the way right now. Which mattress is good? Okay. Again, there is no good mattress, and at the same time, there's nothing like a bad mattress. They will say like cotton mattresses are bad. I have the imported Dunlop one. No, 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 no. A new proper cotton mattress is also fine. Idea is any surface on which you are sitting or lying down has to support your body weight. It should not sag with your body weight. Okay, so sometimes a lot of 7-star and 5-star hotels, when you go to, their mattresses are such that you're sinking into it and you feel great about it. But believe me, that's a disaster for your back. It's the worst thing that you can use. Any mattress, be it cotton, be it normal cotton, Coir and Dunlop, I think that's the combination that they use. Those are the best mattresses to have. Again, if you have severe back pain because of a certain pathology, and the doctor advises you for an orthopedic mattress, yes. Otherwise, a normal cotton and Coir mattress is fine. A mattress which will not sag with your body weight, and at the same time, there is no need to पाठीला त्रास आहे म्हणून wood के ऊपर सोना है. No, you do not need to torture yourself like that. Just get a firm mattress which is equal parts Coir, equal parts foam. Alright, support your body. Don't let it sag. That's all the mattress has to be. Okay, so that we have covered most of the things for lying down. A quick tip on people, I think Dr. Pallavi mentioned something about people who need to be standing for long hours. So how do they protect their spine from stress while prolonged standing? Yeah. Okay. So whenever you're standing, there's a I think I need the camera to show the. Okay. So remember, whenever we are standing on one surface for a long time, again, this curvature at the back that we are talking about is exaggerated and we start feeling fatigue. All right. Whenever there is a event or any circumstances where you have to do a lot of standing, just change the height of your legs. What do I mean by that? The minute I put one leg on a higher surface and the other stays on the ground, my back has gone flat, my low back is relaxed. Okay, you can try it yourself right now, everyone watching. Just stand, take a pillow, place a patla stool, take a leg, place it on that, see what happens to your back. You'll immediately feel better. So like in this way, whenever you need to do standing for a long time, especially ladies, if you have people coming over and you're going to be standing near the kitchen for long hours, no problem. Try to, of course, the best option would be to intermittently sit, take a break. But if not, keep something below of a different height to the floor. Keep switching your legs. This will help to reduce the stress on the back and keep it relaxed. So at the end of the day, you may have some fatigue, but at least you will not have too much pain. Okay. So this was a quick tip for people who need to stand for long hours. And in the beginning of the session, we mentioned that amongst all the reasons for back problems that are there, we are going to tackle biomechanical and the ones related to stress. Now, when it comes to the management part of things, everything remains the same. But the question that is most important to understand, and probably we all feel like, why should stress cause back pain? I will get into the details of that in a bit. Okay, I think we are almost there into the evening now. We started in the afternoon, we are into the evening. So the last part of today's talk, why does stress cause back pain? I mean, it's like, I'm stressed, why should I have back pain? And those questions are very common. Something which is perceived as emotional, mental, why should that cause a physical problem, right? But first of all, so the topic given to me today was stress management. Okay, so when I was told about this topic, I just remembered Sadhguru's words. Him saying that the word management is always associated with something positive. I manage my portfolio, I manage my stocks, I manage my account. These are all positive things you need to manage. Why would somebody want to manage stress? But unfortunately, we are in times where the most important thing which needs to be managed is stress. Now, the stress could be of any kind, all right? There is something called good stress. What do I mean by that? Stress basically is about secreting a hormone. Okay, this hormone is called cortisol. When you are faced, when supposing, an unimaginable situation like a lion going to attack you, all right, the hormone that is secreted is cortisol. What happens with this hormone? It saves you. Because of its production, you're running. You're running for life, and that's what saves you. But once you're out of danger, the levels of that hormone come down. You're back to your normal hormonal levels, so to speak. Okay, so you're out of that danger. But when you're faced with something which is continuously producing this hormone, you do not plateau down. You stay up in that peak. So the hormonal level, the cortisol is always being produced and you're always in that state of agitation. That is the main reason for the back pain. What do I mean by that? What I mean is that anything which causes you stress produces the cortisol hormone. But once that stress is taken away, or that danger, so to speak, is taken away, the cortisol comes back to its baseline level and you return to the non-agitated level. But in the present times, we are stressed about not just actual things but imagined things also. The Gita has a very famous saying, or rather Gita has, I'm talking about the Bhagavad Gita, by the way, that stress can only be given to you if you ask for it. All right, what do I mean by it? There is nobody and nothing in the world which can cause you stress if you don't allow it. But unfortunately, we are stressed by everything. I am stressed right now because they're telling me my time is up. We are stressed about making deadlines. We are stressed about mother-in-laws, sister-in-laws, brother-in-laws. We are stressed about everything. Anything that can cause stress and we know about it will cause us stress. It's as simple as that. So what happens because of this? Because of this constant state of mental agitation, the hormone cortisol is all the time there in our system to very high levels. And because of that, the body interprets it as a fight and flight kind of a scenario. And the muscles are in a contracted state because of that. Okay. But usually when the danger is taken away, the levels come down and the muscles relax. But the way we are perceiving stress these days, the hormone is all the time at a high level, which is why the muscles are all the time contracted. And any muscle which is overworked and it's in a like a spasm, what we medically use the term spasm, in a contracted state all the time, is going to cause you back pain. A muscle needs to be relaxed. That's normal. A muscle which is not relaxed is not normal. So because of this hormone present in the body at very high levels at all points of time, muscle contraction remains. It is not relieved, which persistently over a period of time causes back pain. That is how stress will cause you back pain. Now, how do we manage this back pain? Don't take stress. Simple. That's what the Gita tells you. Impossible to do. All right. So what do? The cause could be anything. The management in terms of exercises, stretching, and medication, if required, will remain the same. But in addition to that, there are things which you need to do. The discussion, of course, can get very philosophical. So we'll keep it brief. The techniques that you need to do, you need to find some kind of relaxation technique to get rid of that muscle tightness, to bring those hormone levels back to normal. Be it meditation, be it, yoga, be it deep breathing techniques. Lots of options are out there. You have stress management therapists available to you. These are your options for managing the stress. But the back pain which is caused because of this stress, the management for it would be similar to what we have discussed about for biomechanical back pain. The muscles are tight. We need to concentrate on our stretches. We need to develop our core. We need to make sure we are using the correct posture. Okay. So stress or no stress, you need to take care of your spine. You need to treat it well. You need to make sure that its alignment is maintained at all points of time. If you need to be conscious. That's the word I think you need to take away today, that be conscious of your body, be conscious of how it needs to be physically in this space. Don't use it so, it's like having a BMW and driving it like a Maruti. You expect the mileage and everything out of a BMW, but the way you are driving it is like a Maruti. No offense to Maruti, but I'm just trying to tell you what we are doing with our bodies. You need to treat it with respect. You need to treat it well. And most importantly, your spine, because you can't see it, but that's what's holding you up there. So take care, everyone. I'm ready for your questions. Feel free to, I hope I can answer most of them or some of them at least. I'll take this up. Okay. Okay. Hi, Dr. Nikhil. So you are going to be a doctor. Good for you, or bad for you. I don't know which one. But yes, medical professionals do face a lot of back pain. Some of the stretches, Nikhil, that we demonstrated today will definitely be helpful if you try them. Especially when you're standing for long hours, try to do the stretches that we have shown in the, standing position. Also, if possible, the standing position, the variation and the height of the surfaces which I have spoken about, try to incorporate that with whatever available resources that you have. And also you need to get into a proper back strengthening program. Now, to demonstrate all those exercises in one particular session would be difficult, because remember, uh, because a back ache or back pain, even though biomechanical, could be because of different muscles being weak. So an assessment by a therapist as to which muscle is actually weak is extremely important before we put you on any exercise regime. So please do visit one of the therapists close by, let them assess you for your weak muscles and put you on a strengthening program. But yes, given your profile, whatever stretches we have shown you today will definitely help you. Mr. Iyer is asking me, can slip disc be permanently cured? I think this answer coming from a surgeon would be more appropriate, but yes, from our experience as therapists, we don't know that it can be completely cured, provided at which level your slip disc is. If you mean non-operatively or operatively is the question you're trying to ask, it's a call we'll need to make only after we have seen most of your investigations and clinically assessed you at to which stage of slip disc you are. But irrespective of what line of treatment you take, exercises are going to be important, and to make sure that your back is strengthened and whatever problem you have presently does not recur. Yes, most definitely, Mr. Deshpande. Physiotherapy is definitely helpful in slip disc. Again, like I said, depending on the level of slip disc, whether you have been advised surgery, not advised surgery, taking from there, if you are operated post-operatively, you would require physiotherapy to make sure that operated muscles are strengthened and further weakening of the rest of the vertebrae doesn't happen. And if you are in a stage where surgery is not required, exercises are extremely important so that we are able to develop the muscles in such a way that they act like a kind of belt around your spine and give it the protection and the support that it requires. So yes, physiotherapy, definite help. Yes, Swapnil, our entire lecture today was structured for sedentary job profiles. So working from home, like I said, first of all, take a look at your work station, as we say, your table, your chair, how you're using your laptop, whether it's of the correct height or not. Use the guidelines that we have given today. If you have neck pain at the end, first of all, apply ice. Okay, ice fermentation. You could even do heat fermentation if you require, but for this kind of a neck pain, usually ice works better. So apply it at the end of the day. You'll feel the muscles relaxing because they basically become tight at the end of the day. So try to relax that with the ice fermentation. Intermittently do the stretches that we have shown you for the neck. And also there are further strengthening exercises which will help you. So do visit a physiotherapist and take down on program. Okay, Mr. Bhojraj, you're very specific about your disc which is protruding. So like I said, if for this kind of a case, we would, before putting you onto any kind of a program, we would obviously want to collaborate with a spine surgeon. So, we need to have an idea from him whether what is the level of your protrusion, whether it is causing you any neuropathy, neural, what do you say, the neuro component, how much nerve compression is happening, whether it is level 1, level 2, level 3, like we medically put it, which level is your slip disc at before we are able to put you onto any kind of program. Or so at least a basic MRI would definitely be needed. Okay, so Mr. Hemant, I did do a segment of the pillow, what type of a pillow should be used for neck pain. It again depends on what position you sleep in. Like I mentioned earlier, and I demonstrated also that if you're going to be always look at the height of the pillow. I mean the thickness of the pillow. Which pillow is good or bad is not the call here. The call is about the thickness of the pillow. If you are used to sleeping straight, you may not require a pillow, or you may require a very thin one. And if you're used to sleeping on the side, you may require a slightly thick one, because your neck in the side position would be in this position and you need to bring it straight. So ideally it should be a little thicker if you're used to sleeping on the side. Tanvi, exercises for low back pain, there are thousands of them. So please come down. Let us teach you some of them. Okay. One last question, if somebody has. Unfortunately, exercises are difficult to show like that. I'm sorry, this is in Marathi. I cannot read it. Back pain. I am. Okay, Tushar, mild lordosis. See, first of all, lordosis is normal in the back. All right. You having mild lordosis basically means your lordosis is a little bit exaggerated. You know what we spoke about when the anterior muscles are weak and your back goes into that hyperlordotic posture kind of a thing. That basically is an imbalance between the two muscle groups. So just train your core muscles. Learn exercises to train the core and the back muscles, and to get a normal lordosis. If you don't have a lordosis, also it can cause back pain. So having lordosis is not a problem. What the doctor probably is trying to tell you is you have got an exaggerated lordosis, which happens because of muscle imbalance, and it causes back pain. Okay. So thank you very much, Sahyadri Hospital, for organizing this, and I hope we have answered most of your questions.